Good evening and welcome to the Cabarrus County Board of Education's Monday night, January the 4th, 2021 work session. I will call the meeting to order and ask that we have a motion to adopt the agenda as presented.
So moved.
Second.
I have a motion by Ms. Blackwell and a second by Mr. Walter. All those in favor say aye.
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 Opposed? Thank you. I want everyone to know that most of the board members are here. Tim Furr and Carolyn Carpenter are joining us virtually, and the rest of the board members are present and accounted for and are wearing masks and social distancing. So with that, we are going to invite Ms. Amy Goff from the Cabarrus County Education Foundation to do her presentation.
Thank you for having me present today. As it was mentioned, I am Amy Goff, the Executive Director for the Cabarrus County Education Foundation. And I realize that some of you are familiar with CCF previously, but wanted to provide an oversight of the Foundation's latest work since our organization has undergone quite a few changes over the last few years. To do that, I will provide a brief introduction to our organization, talk about CCF today and how we are helping our district, and wrap up our focus for continued growth. Next slide, should be 2 down. I want to start with the foundation, with what is an education foundation. Next slide, please. Believe it or not, this is a challenging question because really there are no two education foundations that are alike. Some foundations run all volunteer, some have 1 or 2 staff members, and some have 10+ staff members. And annual revenues can range anywhere from a few $1,000s to $2 million+ annually. But what is common among education foundations are these basic characteristics. We're a 501c3 nonprofit organization with our own separate board of directors, and we focus on fundraising and programs that support students and staff of the district they support. But let's take a look back for a second to where it began. CCF began with a vision from Grace Minette, a longtime CCS teacher and later a Board of Education member. She, along with Roy Davis of S&D Coffee, founding board members, kicked off the foundation in 2001. At this station, the foundation was closely aligned to the district, with most of the board coming from key district administrators, retired educators, and parent representatives. And its focus was primarily on supporting the district's initiatives. In 2013, Grace challenged the board that to grow, they needed to invest in hiring an executive director, which they did. And the organization began focusing on expanding support by initiating the CCF corporate luncheon and expanding the classroom grant program and establishing a scholarship program. But in the last 3 to 4 years, data from the Cabarrus Chamber study of their members indicating that workforce development was their #1 priority, and also a study from our own CTE department indicating that local businesses wanted to connect with schools but didn't know how, fed into a major strategic evaluation of who we were, what we do, and why we do it. As such, we began changes, including diversifying our board of directors to include not only people from the education sector, but also many business and community leaders. Next slide. Additionally, through these efforts, we identified 4 current areas of focus: to support student achievement through funding innovative teaching opportunities, inspire our educators, serve as a conduit between our businesses and our schools, and to build a community that supports and advocates for Cabarrus County schools. And we looked at why we do what we do. And we see a twofold purpose. First, we truly believe that when our teachers feel valued and supported by an involved community, they instill a passion for learning in their classrooms where students thrive. And just as crucial is the necessity to plant the seeds for our future workforce and create tomorrow's leaders. While we cannot do any of these things without the district's partnership, in the next couple of slides, I will highlight just a few of the key contributions we have made. During this school year, we have provided over $21,000 to teachers for much needed student resources, such as online science simulation programs, online math manipulatives, at-home science lab kits, and many other exciting teaching opportunities through our Impact Grant program. We also provided over $15,000 to the district last year to purchase hotspots for students when schools suddenly transitioned to remote learning prior to the CARES funding. We also funded the first education scholar, Alyssa McNeary, by providing the $10,000 in stipends to assist CCS in recruiting top needed talent from North Carolina State University. And we continue to fund monetary awards for the 5 finalists for the CCS Teacher of the Year. We also connected CC Griffin with Cabco TV as one of the 15 projects we have facilitated through our Cabarrus Link program that connects schools with local business partners to bring real-world learning experiences to CCS students. For several years, 8th graders had created podcasts or TED Talks about what mattered to them. However, their teachers did not think that the project was hitting the mark in content and production quality as they had hoped. So in the planning at the Link Day event, their partner challenged them to consider how topics were selected, committed to work with students to understand how to tell a story, and also discuss solutions to production issues. The final project ended up having the 6th graders designing sound booths as part of their study on sound waves to be used by the 8th graders in the production of the podcast. And the podcast content was so much more than just the statistics, but actually told the story of what really mattered to them. And let me tell you, some of those topics would blow your mind away for 8th grade. This project also garnered much good publicity for the school as it was shared with current and future parents. Additionally, we've supported the CTE department and the Science Fair Showcase by recruiting local businesses to participate in task force, advisory boards, serve as judges, and in other needed capacities. Let's see. We've also connected in-kind donations, such as J.M. Robinson High School with the Gray Foundation to receive Chromebook covers as a beginning step as they begin a joint mentor program helping students to determine their next steps in their career pathway. Next slide. And we have expanded our donor base through events such as our Partners in Education Lunch, CCF's Game of Games Night, and assist our CCS parents during Teacher Appreciation Week with our Think a Teacher gift catalog. As we move forward, we've identified several critical success factors. As you can see, as I wrap up my presentation, I would like to express how thankful we are for your support with a board liaison and look forward to working with Denise this year. But I also ask you to consider what you can do, each of you. And that's become an ambassador for our organization. Share the impact the foundation is making for our CCS students and staff. Promote and attend our events and fundraising efforts, and consider what we can be doing to help the district even more, because that's what we are here for, to help the district. To conclude, this quote from Brad Henry sums up why we feel the foundation is forever critical. Current tax-funded resources can only do so much, but the foundation is the vehicle by which our local community, individuals and businesses, can invest in ensuring our CCS students are prepared for their next career step, whether that's directly into the workforce or attending a certificate program, community college, or university. So I want to thank you very much for your attention tonight and open the floor to any questions.
Thank you. Board members, do you have any questions or comments?
I just wanted to say I look forward to serving and being a part of the team.
Okay, we're excited to.
So thank you, and we'll just acknowledge, I think I sat on that board in the beginning in 2003 or 2004, and where it started and where it's gotten to is just great. It's awesome. Cabarrus County Schools and Kannapolis City Schools have greatly benefited from the Education Foundation and the vision of the Minot family for education in Cabarrus County. So thank you.
Thank you.
We appreciate you being here tonight.
Thank you.
All right, board members, we are going to move on to your discussion items under number 4.01. We'll ask Deputy Superintendent Brian Schultz to join us, and he will start the slide presentation.
Good evening and Happy New Year to everyone. Looking forward to 2021. So as soon as we queue up the presentation here, I'll start. So I want to go ahead and review the data from the last 2 weeks, since we had a little bit of some downtime. We did not get that data to you over the last 2 weeks, so we'll make sure we cover that very briefly in this overview. And so we'll start out, probably no surprise, I guess, to you. The data is going to be no surprise. We've heard a lot about it in the news, and we see a lot of indicators still going up. And so we'll see that over the last month, we've seen across the state 175,000 new cases, which is pretty dramatic when you think about it. And then just if we look from our 2 data points that we look at throughout the course of this presentation, we look at it from Thursday to Wednesday. So Thursday of 12/24, Christmas Eve day, to the 31st, the week of the 31st, which was the next Thursday. Looking in 1 week's time across the state, we had 39,000 new cases. All right. And we look at the daily cases across North Carolina. You can see, the giant spike in the last month or so. We on the 12/24 we had 7,700 cases, and then on 12/31 a daily rate of 6,700, and just really a preview of things to come. You'll see that you can kind of see past 12/31 on January 1st and January 2nd. Those were the 2 highest days in the state on record, and you can see those spike points up there, and that'll be in next week's data when I forward that along to you on Friday morning. And we do see in there 2 days after Christmas on the 27th, there was one of the lowest points really since over the last month and a half, 2 months, at 2898. There's some explanation on why that was so low. Potentially people just didn't go get tested after Christmas, and that could be why we saw a couple low points there. The next slide, you see the percent positive across the state. And really, if you look at that point of 1125, right around Thanksgiving, that was really the last time it was in single digits. That was at 7%. And then since then, you've seen that it be up in the double-digit range, 10.3 on 12/22, and then 13.7 on 12/29. All right, then move along to the North Carolina daily hospitalizations. I decided to show you the graph of just the month alone. But do know on 2 months ago, so we've almost tripled in 2 months. On 2 months ago, on 11/3, the state had 1,175 hospitalizations. Fast forward to 12/3, almost doubled at 2,100, and then fast forward to 12/31, you'll see 3,400. So in about 2 months' time, we've tripled the number of hospitalizations across the state. And then we'll go to the next slide, which is our local data here in Cabarrus. We've completed the month of December, so we look back from 12/17 to 12/24. You'll see the jump of cases from 9,201 to 10,285. That was an increase of 1,084. There 1,084 new cases during that week, and that was certainly the highest on record in Cabarrus County. The following week kind of showed the same trends at the state, where there were some really low days there after Christmas, and we had an increase of 876 new cases from 12/24 to 12/31. And just again, I can give you a little bit of preview, because since we're a little farther into our weekly cycle, currently we stand at 742, and that's in 4 days. So we'll certainly be over 1,000 this week if that trend continues, and quite possibly the highest week on record that we're in right now. And then we also, similar to the state, on January 1st, our county, Cabarrus County, had the second highest total number of cases at 206 in a day. And then the very next day, on January 2nd, we had the number one highest day in Cabarrus County at 241. In terms of percent positivity, last 2 weeks we've seen a percent positivity rate at 13.9, and then consistently holding at 13.4 at this last count. Go ahead. And then looking at the hospitalizations, again, kind of looking at that month trend here, we see hospitalizations doubling over the last month here in Cabarrus County. And so at our highest point being 110, you kind of see that a couple of days ago at 110, but on the 31st, it was 109 hospitalizations. All right, and then lastly, the last slide, just a preview of things to come. We added the quarantine, the number of quarantines that we're going to give you for staff and students. We were able to get that to you prior to break, but as we come back, staff coming back today, we'll be able to get that to you by the end of the week, the number of staff and students that we currently have quarantined, and we'll get that to you by no later than Friday. And we'll certainly be able to look and discuss that on next Monday at the board meeting if needed. So with that, I'll turn it over to Chairwoman Grimsley.
Okay, so I'm actually going to just ask a couple of questions before I start with the board members. I want to make sure, Ms. Carpenter and Mr. Furr, do both of you have these slides available through board docs? Yes, I do. Mr. Furr? Okay, great. I just want to make sure. Okay. With that being said, I want to confirm, so the hospitalizations, now Cabarrus County was 61 on that slide, correct?
Yeah, and that data came because the typical calls weren't done over winter break, but I was able to get an update of...
Hey, Brian, are you keyed up? It's okay.
Thank you. Sorry about that. So yes, I was able to get an update. The typical calls weren't done over the winter break, but I was able to ascertain data from 1221 and 1228. So the 44 number that you see under 1224 is actually from 1221, and then that you'll see that increases a week later on 1228 to 61 Cabarrus residents.
Okay, and I actually just wanted to point that out because Dr. Louder and I, are on the call on Monday mornings with the Health Alliance and that group, and they made the statement today that they are no longer accepting out-of-county residents. And they've closed to allow room for just Cabarrus County residents. So I think it's important for people to understand that our hospital is a hub. I know we've probably said that once or twice, but for those that have never been or have not heard that information, I think it's important that they understand that they did receive a lot of out-of-county residents. But I know they made the statement that just recently they have closed that down to just Cabarrus County alone. So I'll be interested to see how those numbers look maybe next Monday. Okay, so with that, I will start with Ms. Blackwell, if you would like to have a question or a comment.
Sure, thank you. So I think at the last meeting I had asked about the quarantining and what the CDC was recommending. And then I realized that on that last slide you said that you'll have those updates. I was curious because I was looking at the policy that we have at Atrium Health today and regarding the quarantining for household exposure. And the way that it works with Atrium is that if you have a household exposure, then you are required to be out for 10 days. And we're currently how many days?
So if you are exposed, it's a 14-day quarantine.
So we have a 14-day quarantine, but our Atrium Health has a 10-day quarantine. Is this something that we're looking at as far as, because I know that one of the issues that we have right now is teachers having to be quarantined for an extended period of time. So I guess my question is, could we have some level of, consistency? Because I know that with Atrium, they're also working with the Cabarrus Health Alliance too. So I would kind of think that we would want to streamline maybe those quarantine methods. I don't, if that's something that you guys could talk about.
Sure, we've done some work with the Health Alliance on that, and I can't speak for Atrium, but I can speak for what our two things. So I'd point out the CDC recommendation is actually still 14 days.
Okay.
They do allow for a 7 and 10 based on exposure or tested positive. So the guidelines have changed, but the recommendation is still 14 days if you're exposed. And the Health Alliance still maintains the same recommendation as well, and actually have recommended that to all county governmental agencies In fact, on one of our calls with them, the first responders, the firefighters, police officers, all the EMS, county workers are still following that same recommendation as well. So that we've worked with them and followed their recommendations on everything that we've done up to this point. So that is what their recommendation has been to us, and that's what we'll continue to stick with.
Okay, all right, well, I just, I was wondering because it just seems like there would be some level, I guess, of consistency with, all of the businesses that are partnering with the Cabarrus Health Alliance, so.
Yeah, our consistencies with the government agencies within the county, and it does, the CDC recommendations do allow for businesses, organizations to, if they are, I guess, stressed for people to cover roles.
Which I would assume that we are,
They can
right?
adopt that to meet their needs.
I mean, I would assume that the school system is just as stressed for employees to come in as Atrium Health would be with nurses and faculty, facility workers at Atrium Health. So it may be something that we need to consider going forward, just because of the level of people that we're going to need in order to open the schools back up like we hope to do. So that was all. Thank you.
Thank you. Mr. Walter?
Hey, Brian. I guess a month ago, we made the decision to go to Plan C. Do we have a comparison on what the numbers were then on that date compared to what the numbers are today? I mean, your presentation was close, but I don't think it hit the...
Yeah, are you talking about in the last board meeting where we made that decision to do that?
Yes. Obviously, they're higher, right? So we're talking about how
It
much?
is definitely higher now, yes. I mean, I'd have to go back and double check and can certainly give you those numbers, but yeah, so if you look, I can't remember the date of our last board meeting, was it the 17th? Is that right?
Oh, it's been like a month since we made the...
Yeah.
Maybe, Brian, if you want to put that in you compile that information anyway, maybe you could go back and do that graph to give us, I don't know, I'm not sure what you're asking for, Mr. Walter. Are you wanting something?
I just want to know what the increase was since the time we made our decision.
So you want him to go back to that board meeting that night of the report? Is that
Whatever
what
the
you're
number
saying?
was, yes.
Yeah, the new cases were in the 900 range per week.
The active cases, though?
Yeah, so there, in the county, there were 900 cases. So looking back on the slide that has the total cases and active cases, it was somewhere, it was like 960 from 12/10 to 12/17.
And it's now what?
It was 1,084 last week. It was 876 this week. And then this week, the 4-day total is 742.
Active cases?
Yeah, so, no, that's new cases.
What's the active cases?
Yeah, active cases the last 2 weeks were 1626 and 1725. And then back on, December 10th, we're at 1458, and 12/17 was 1520. So it's gone up about 100 each week since then. So it went from 1,400 to 1,500 to 1,600 to 1,700.
And according to the information we got today, there are 2,200 active cases in Cabarrus County today.
Okay, that's different. 2,200 now? And we're expecting it to still continue to go up? Is there a Christmas, New Year spike that's anticipated?
Yeah, I mean, it's an estimate of about a 2-week span after high travel and
So
high
what
visitation
date
time.
would that be?
So, I mean, it could be, you could pick New Year's, or you could pick, the days before and after Christmas.
So 2 weeks from New Year's or 2 weeks from?
I would say to be on the safe side, you pick two weeks.
I'm just
from
trying to see,
New
what is our anticipated high spike here on numbers before we start seeing some declines?
Yeah, I mean, people have projected that we're still going to see increases, but I haven't heard a number projected. I don't know, on your call this morning, did they?
Yeah, Mr. Walter, I think it's probably going to be a little more informative this next Monday when we do the call. That's done every Monday, because that'll get past the holidays, and I think that information will be a little more helpful. And I can have that night, so is
And
that?
how do we compare around counties around the Charlotte area, do we know?
I don't, but we can, I tell you what, how about you email me what you really want?
Sure.
And we'll go from there. Is
And
that-
all that's on the state website, so you can go in and pull any county up and click on any county anytime. You can look at
Yeah,
that.
but typically you guys provide all that information to us. But
Right.
anyhow.
And if
And
you
last
want
one is,
some-
we have a vaccine that's coming out now. At what point do we know when the general public can get that vaccine, or is it still just healthcare workers?
So I'm going to cover some of that when I do my comments as soon as Brian is done.
Okay, those were my questions.
Okay, was that it? Okay, good. Ms. Sandage?
I don't have any questions for Brian and the numbers per se, but I do have a few comments, and I don't know if I need to just wait until after you've finished for those.
If it's for Brian specifically, you're welcome to do it now or after my comments, either way you want to do it. You want to wait? Okay, sounds good. Ms. Adcock?
Yes, I would just like to maybe suggest or recommend that we also look at on the Cabarrus Health Alliance, there's a chart that shows cases by age for Cabarrus County, and it has it split. So, for example, it says that 3% of total cases are between the ages of 5 and 9, 4% between the ages of 10 and 14, and 3% between 15 and 17, which would be all of our kids that are in our schools. 75% of people that are getting COVID are between 25 and 75 years old. So I really think we need to look at that data when we talk about our kids really the ones that are going to infect our teachers whenever they're in the schools.
Yeah, and I'm open to putting any data on this. I think we talked about that before. I'm open to putting any data that you all as a board agree to putting on this presentation. So I know we do look at that with the Health Alliance from time to time. It is available on the Health Alliance website. It's available on the DHHS website as well. So I'm glad to put whatever data we need to on this.
So board members, if you will email me, especially Mr. Walter and Ms. Adcock, exactly what you'd like to have included. Brian's been really good about customizing those slides and just making our own report. That's what been, more beneficial to us. So just email me what you'd like to see, and we'll take care of that. Okay. So Ms. Carpenter, I will start with you. Any comments or questions for Brian?
Well, you had mentioned in two, and you probably got the same website that I have talking about the vaccinations that's coming up, and I'm sure you're going to go over it talking about, one of the big ones that's going on right now at the arena, or is that the one you're going to refer to? Because
It is, yes, ma'am.
One of the things, well, if you're going to go into it, because that was the question or what I wanted to make sure that people are aware of, when our teachers will be, what category they will be, and when that will be, they will be able to be vaccinated. Because that, and if you're going to go over that, because that's, I think, is going to be very important, because that's been a big concern, and I think where most of our emails have come into play. So if you're going to go over that point, that would be fine. So if you're going to go over that, that will be great to make that known. And one thing, and I don't know if this is the time to talk about it or not, myself and Miss, I just had a loss. Our new board member, we were in the CI meeting, and there has been one of the big things that we have all been worried about is the children and what they have lost this last 9 months. And we, in our CI meeting, we were talking about what's going to be coming up. And one of the big things we talked about in that meeting is talking about the summer programs we're going to be offering. We're going to be offering the summer camp for 3 weeks. We will be offering our reading program, and we're working on all these things. And that summer program will be offered to kindergarten through 8 and high school. And this is going to help these children for a lot of the things they've lost. So we're working on that right now. More details will be coming out when we get all that ironed out. But this will really help all our students. And this will be our EC students, our regular students. So we are working on those details right now. So this is some good news. And so when more details come out, and then also where they can make up their EOG scores. And so we're going to have 3 different programs, and so more information will be coming forth on that. So we were really excited to hear that. And those camps will be being held in June and July. So when we get more details, we'll let you know on that.
Thank you. We appreciate that. Mr. Furr?
Yes, I would just like to mention that what Ms. Blackwell said about the changing the length of time. Drastic times, you got to do drastic things, and if we got, our goal is to get those kids back in school this school year, then we're going to have to look at alternative ways, and if that means changing it to 10 days instead of 14, that's just something the task force, I guess, will have to look at. And Ms. Carper, I'm glad you brought that up. The summer programs are good, but no offense, but 3 weeks is not going to make up for 9 months. And that's all I got.
Okay,
Well,
thank you.
Mr. Furr, every little bit helps. I mean, we've got desperate times, but what I'm saying is, and one of the other things that I would like to mention, and this may be when Miss Klutz comes on, maybe this will be the time to talk about that, but I'll just wait till she comes on, because again, it'll be something we may have to speak with our legislators about, but I'll wait till Miss Klutz comes on, because it's a money issue, so I'll just wait till she comes on to ask her about this.
Okay, thank you, Ms. Carpenter. Thank you, Mr. Furr. So, Brian, I thought at this point in time I'd break this into 2 different sections, talk about the task force and then a little bit about reopening schools. So we've had a lot of questions, a lot of emails about the task force in itself and how it's comprised. And I'll just tell you tonight, there are about 36 members. They've been broken down to 4 subgroups of about 8 or 9. Those subgroups have met at least once, if not twice. A couple of them are meeting this week. So I hesitate to put anything definitive out there of what's come out of the subgroups until maybe they finish this week, and then we will have a better, maybe more in-depth report on Monday at the business session. As far as how it was comprised and the members, it's teachers, administration, principals, parents. It's got the Health Alliance members on there. There's community liaisons. It represents our across the board of Cabarrus County Schools, the teachers, transportation. It covers all that we have to deal with, and they are doing a really good job of identifying challenges and issues that we need to have resolution to in order to move forward with a Plan A. And that's what they're discussing. They're also, at this point in time, deciding if they need to add people for information or just gather information. They're kind of just getting into a skeleton structure, if you will, and getting their game plan together. And I'm sure, Brian, with being our main facilitator, you'll be able to give us a little bit more of an update on Monday after the 8th. So I'm assuming the 8th is when they're all going to come back together and discuss what they've discussed actually in their subgroups. Is that correct?
Yeah, that's correct. As prior to this Friday, they will have met twice in their subgroups. They did once Friday the 18th before we let out for winter break, and then one met over winter break, and then the rest of them are meeting this week to look at things like the metrics, the transitions in between plans, the groupings of students, as well as coverage strategies to the point of, if we're down staff, the strategies that we can use and implement to make sure that the courses and the classes are covered, as well as, workers such as school nutrition and bus drivers and things like that. So yeah, they've made a lot of progress in a little bit of time. We wanted to make sure that we met prior to winter break to keep this moving along, and each group has elected a facilitator and assigned a note taker, and so we will meet again on Friday to kind of look at some draft ideas that the teams have developed, and we'll make some recommendations to the superintendent, and then bring those recommendations to the board. So we're excited about the team. It's a great group, really great cross-functional group, people represented from all areas, the community and the school system as well. So really excited about the work that we're doing.
I've gotten a lot of good feedback, from different members, and I'll recognize that Board Member Denise Adcock and Board Member Keisha Sandage both sat on the task force and in a couple of those subgroups. I think, I've heard some feedback that people were saying, it seems like we have several hurdles to get through, before we can really identify what this plan looks like. But I think that's the real, issue that we're dealing with completely. It is all the different areas that we need to get through to kind of identify what we've got to resolve before we can get into a plan A. To me, a couple of the issues that I saw that was the most discussed was bus drivers, of course, transportation. That's how we get our kids to school. I think it's going to be real important that we get surveys out to parents to let us know if Plan A is going to be an option for them and if they're going to need transportation. I think that's a huge piece of that puzzle that we're really going to have to identify. And I saw some feedback that parents may not always, do the surveys or get information back to us in a timely manner. So at this point in time, I would ask that if when those come out, that parents and teacher surveys, any survey that we send out, it's really important that you respond and that you give us the information that we need to start making these plans. And then also was the substitute teachers and the teacher fill-ins. I would like to ask, I'm not sure, I did not see where the substitute teacher policy was looked at, so I don't know how much information you've given to them for that piece of it. But there's a lot of, I really want our policy, our policy to go back to the policy committee to be looked at. And I think that would be real beneficial as well, because that group is probably not going to be able to do anything with it except to say that there's a lot of requirements and that we needed to either relax those or change those, and that's going to be up to the board, and that starts with the policy committee. So I would like to ask that policy be returned to the policy committee for review.
Yeah, the coverage team has addressed that. There's a person from Human Resources on that team. They have not met yet this week, but that will be addressed, and we've talked to Ms. Jones in HR about that as well. So, and then Ms. Burns is back here, that represents policy, so we'll make sure that we pull any policy related to review in our next policy committee meeting.
Great. And just to touch on it, especially, I'm not sure which two groups y'all actually sit on, but it was concerning to me to see a complaint that our requirement for even a retired teacher is to send a college transcript back in, and several other items that they have to return just to be listed as a substitute teacher. I find it hard to think that we don't have all that information if they've been in our system. So to me, that was a crossover where we might have some problems. I'm not so sure that retired teachers being in our system for any length of time would want to go back and try to find all that information, and I'm not sure why we wouldn't have it. They've definitely had to go through, the background checks, whatever they needed to do to come out of being in our teacher pool, but now going into our substitute. But I can't imagine them having to go back and find a college transcript.
Yeah, I mean, we'll check into all that
Okay.
I know Dr. Louder's talked to Ms. Jones about that. I've talked to her about it, so I know that I know there are some state requirements that aren't Cabarrus County requirements as well. So
and I guess that's where we need to decide where
Right.
is the problem. Is it
Yeah.
a legislative issue? Is it a federal guideline? We know the sunset rules for the retired teachers, but that to me was important to find out which level of area, is causing the real holdup. Because if it takes 30 to 60 days to get somebody approved, that's a really long time for our substitute pool to be, diminishing as it is as these quarantines take place and not be able to fill it back up. Okay.
All right.
So with that, I know we need to have is there any questions about the task force? I want to start there with that. We'll begin with that. Ms. Adcock, would you like to start? Comments or questions?
I'd just like to say that I think the task force was a great idea. We've had a lot of people involved and a lot of ideas, things that we probably would never have known about had we not formed it and had our first meeting. So I think it's a great tool, and I think it's going to help us tremendously.
Great. Ms. Sandage?
Sure. I have several things to say about the task force and several questions that I'll send to Dr. Louder and to Brian as well. In participating, we've met 2 times in my group, and initially I got this us versus them mentality, and I truly want us to get away from that and understand that this is a community issue and that we all are in trying times and need to work together through that. One of the things that I walked away with, or several things that I walked away with, was we've got to identify what we need from our community to help us through this, and then ask for it, whether that's putting it on paper, whether that's saying that here, or whether that's getting it to them some way, somehow. The other thing that I was going to say is people should have a choice as to what works best for their family. And I mean that in every sense of what I said, from our teachers to our parents to our students. They should have a choice to figure out what looks best for them, and we need to honor that or support them in doing that. Some thoughts to consider that I've written down as we move forward. I've said in these board meetings, 3 times now, and I've heard very clearly, our public has asked us for a plan that allows them to plan for their families. We have every ability to do that. Our school staff have asked to be a part of the discussion and allowed a choice between in-person or online learning. I feel like we have every opportunity to do that, and if we don't, figure out what we need and let's put it in place. Our children want and need stability in education, and we owe them that. Our superintendent and his staff has let us know that whatever we want to put in place, we need to let him know, and he will get it done for us. So we need to start doing those things, and I think they're very, very simple tasks. I'm going to read a quote from Dr. Anthony Fauci during his public health forum at Harvard. And he says, "The data does not show widespread transmission of the virus in school." This was in early December. "Our default position, there will always be exceptions. There is never a one-size-fits-all. Our default position should be to try to keep the schools open and get children who are not in school back in school as best as we possibly can." Fauci added that the children do not appear to be transmitting the virus to adults in school settings either, such as teachers or administrators. He said that the risk to these adults being in school does not appear to be any greater than the risk they face by being in the general community. That spoke volumes to me, and this just was said last month. I'm going to read one more quote, and this is from a retired superintendent in upstate New York. "Dear friends and colleagues, I'm writing today about the children of this pandemic. After a lifetime of working among the young, I feel compelled to address concerns that are being expressed by so many of my peers about the deficits the children will demonstrate when they finally return to school. My goodness, what a disconcerting thing to be concerned about in the face of a pandemic which is affecting millions of people around the country and the world. It speaks to one of my biggest fears for the children when they return. In our determination to catch them up, I fear that we will lose who they are and what they have learned during this unprecedented era. What on earth are we trying to catch them up on? The models no longer apply, the benchmarks are no longer valid, the trends analysis have been interrupted. We must not forget that those arbitrary measures were established by people, not ordained. We can make those invalid measures as obsolete as the crank-up phone call. They simply do not apply. When children return to school, they will have returned with a new history that we will need to help them identify and make sense of. When the children return to school, we need to listen to them, let their stories be told. They have endured a year that has no parallel in modern times. There is no assessment that applies to who they are and what they have learned. Remember, their brains did not go into hibernation during this year. Their brains may not have focused on traditional school materials, but they did not stop either. Their brains may have been focused on where their next meal is coming from, or how to care for a younger sibling, or how to deal with missing grandma, or how it feels to have to surrender a beloved pet, or how to deal with death. Our job is to welcome them back and help them write that history. I sincerely plead with my colleagues to surrender the artificial constructs that measure achievement and greet the children where they are, not where we think they should be. Greet them with art supplies and writing materials and music to dance and so many other avenues to help them express what has happened to them in their lives during this horrific year. That to me says that we have got to change what we are expecting of our children and what we are saying to the public about when students return to school. This is not going to be a normal return, but I think it is absolutely possible for us to do. And again, I'm going to go back to what the public has asked us for. That is a plan that tells them how to plan for the rest of their child's school year. And we owe them that. Thank you.
Mr. Walter?
Thank you for those comments, actually. So the goal of this committee, the task force, is to come up with conditions to bring our kids back to school. So if we don't do anything, come the week of the 19th, kids go back to school like they were. Is that correct? If this board doesn't do anything, the kids are going back to school on the week of the 19th.
Right,
back
in
in
the plan that
B.
yes.
So this task force needs to get the recommendation to us prior to that?
So this is, I guess, the discussion we're going to have. I was going to let everybody make their comments before we kind of delved into this, but we can make that determination. Dr. Lauder and I talked last week that we need to kind of figure out so that we can give parents and teachers a plan to move forward to so that they are prepared. That's what the emails are saying right now. We need to know where we're going to be, what we're doing. I feel like that's what we need to do. This is January the 4th. I feel like it gives them plenty of time to get ready. Whatever we discuss tonight, time frame, if that's where we're going to be, then we need to have that discussion. The task force right now is discussing what the challenges are. They'll probably at some point in time come up with metrics and move towards that. But if they're not meeting, for another week or so, and we all have agreed that we need to get something on the table about a time frame that's going to happen with either January the 19th return or shortly after that, then that's a discussion to be had now for the board.
Right, we're time sensitive, so if we don't do anything,
Exactly, right.
they can plan on going back on the 19th.
That's right. Or we're going to tell the task force what dates we're looking at, and then they can deal with that as far as the discussion item. Okay. Is that good? Okay. Ms. Blackwell?
So just a couple of things. Number one, I'm so glad that this task force is seeming to work out well. That's very encouraging. Kind of just to say some things on the quotes. I love those quotes that you said. One of the things that I think I heard you say, I was trying to write it down, about Dr. Fauci saying not a greater risk than in the general community. One of the things that I want to point out is that what we've seen from this, and of course, all of you know where I've wanted schools to be open from the get-go. I've always wanted parents and children to have the option to be able to go to school if that's what they wanted for their families. What this shows me is that closing the schools or not closing the schools, the numbers are going to go up and down depending on many different scenarios. And for us to close the schools based on those ever-changing numbers is not the best way to do this. We need to, like I've said before, we need to get these schools open. They need to stay open. The numbers are going to fluctuate from time to time. This tells me that people, just because they're not going to school, are certainly not quarantining. They're not staying away from their friends and family because they're still spreading this virus, and it's not being spread at school. So we need to get the schools open. We need to get them open ASAP. And to me, this just shows that even more because the numbers have gone up tremendously over the holidays and schools have not been open. So those are my comments. Thank you.
Thank you. So I know this is a discussion that we're going to kind of be all over the place for this moment, but I guess what we need to identify is, and I had told Ms. Carpenter that I would speak to this, is that they did talk about the vaccines that are being administered. They've had a couple of clinics. They've just recently started that. They've only had a couple of days, so they do not have a lot of information regarding how many's taken it. There's just a lot of things being gathered. Next Monday, I hope to have a little bit more information regarding timeframes. Teachers are definitely in the group 2, and Dr. Lowder, you feel free to comment when I get done, but they are in group 2. They see that moving into maybe towards the end of January-ish, and I hesitate. They asked me not to identify any dates because they really just were not sure. They've just started the clinics. People are getting vaccinated. They've got certain criteria right now that they have to abide by on the dates that they are given. And then group 2 will be our teachers. So towards the end of January is what, they are somewhat identifying, and maybe by next Monday we'll know a little bit more about that. To me, the most positive thing that came out of that today is we have a vaccination and they are going to get vaccinated, or they're going to have the opportunity to. So that, I think, gives us a little bit more of a comfort zone to discuss the reopening plan. And my thought is, as we've talked all along, the task force is really going to do the work of the board. They are doing the work of the board for the reopening plan. Whatever that's going to look like, they are, again, identifying the challenges, the issues that we need to have resolution to, hopefully some indicators of what the board is going to have to do, whichever level that is, if it's a legislative issue, if it's a board policy, if it's requirements that we've made and put in place for hiring, just whatever that looks like. That's their work as we speak. And then when that recommendation comes, we will be able to identify, hopefully, with the staff, a resolution for some of those problems that will actually help us to enact Plan A. But with that decision, maybe we need to talk about that a little bit tonight. As far as the date, it is January the 19th. That's when students will return out of remote learning. And I would like to start that discussion with Ms. Adcock, because I think all of you have had some comments and some questions about the dates and just what that looks like and if we do anything different with that. So Ms. Adcock, I'll let you start that discussion.
Okay. I want to go back to the weekly wrap-up that we just got that talks about how we've been approved, 7 school sites have been approved for the antigen pilot, which is the rapid test. And with that going into our schools, what that will do is help to decrease quarantines, because you will get a result back within 15 minutes instead of having to wait 2 or 3 days. And with that being said, I'd like to propose that we go back to Plan A, K through 3, on January 19th. And then Plan A 4 through 5 on February 1st.
Okay, can you restate those timeframes and those grade levels one more time?
So January 19th, go to Plan A, K through 3. And on February the 1st, go Plan A 4 through 5.
Does that include any special populations?
That's what I was getting ready to ask. Are you going to include EC, OCS, pre-K?
Yes.
Will that include all EC students, those that are in one classroom versus those that change classes?
Yes.
You want to include all the programs? Okay.
Yes.
So I thought what we could do, since you've put that out there on the table, all board members will just, you can comment, we can ask questions, and then Dr. Lowder, we're going to ask you to make comments on that. How's that?
Comments on what? I'm not sure.
On dates or reopening plan?
Yeah,
Does that
there,
work?
there's
Okay.
definitely some concerns with what Ms. Adcock just suggested, so we can talk about that.
So maybe we can just have some board discussion. I'll allow Ms. Carpenter, Mr. Furr to comment as well and ask questions, and then we can have a discussion, and Dr. Lowder can give us his recommendation. So Ms. Sandage, I'll let you start next.
I just want to make sure that I have the dates right. You've got January 19th for K3, OCS, EC. Did I miss anything?
So I'll recap that with EC, OCS, pre-K, and K through 3, right? That's what you said, for January the 19th. And then just adding 4th and 5th grade on February the 1st, correct? And just for the viewing audience, so that everyone knows, especially for those that do not, per the governor, right now, middle school and high school are only allowed to return in an option B. So that's definitely not something that we can change at this point. And the caveat here is also going to be, whatever we discuss tonight, wherever we go with this discussion, we're not real sure what Governor Cooper is going to do or state in this next round. So, I guess we have to keep, an open mind to, if we make a decision here tonight or Monday or, whatever the board's thinking, that could change with Governor Cooper making a different decision, okay? So with that being said, continue, sorry.
So the questions I have, are we able to guarantee at least 3 feet? Are we able to use plexiglass, which I've heard is suggested, because I know those little ones have difficulty with masks. I'm really big on, and I've said this several times, on us being able to survey teachers, because there are teachers who do not belong in a school for varied health reasons. And I learned some troubling things during our COVID task force conversation that I will send to Dr. Louder, and he can send that wherever it needs to go, about teachers being denied for leave and the reason for those denials. I want to clarify that before I go any further. And then I also want us to be able to resurvey parents. And this does still mean, and I'm clarifying here, this does still mean that parents or families are able to determine if they want to come into the building or if they want to stay remote.
That's correct.
Okay, so just to recap what you just said, you would like to know, we've talked about doing surveys. So I think the two, especially the task force, having that discussion about a parent survey, which would go back to speaking to, are they going to enter their children in Plan A or stay remote? And to me, the most important piece of that, because of the situation, is, are they going to need transportation or want transportation? So I think those are already discussion items with the task force, but that's one of your priority lists. That's what I'm hearing you say. The surveys, correct?
Yeah, and I think some of this stuff we will be able to iron out in talking with the task force, but my concern is the communication, maybe breakdowns, being able to get information to the public before us meeting again. Does that make sense? Mm-hmm. So how does what the task force determines or helps us with get to the public before, we go back to school 5 days later?
Mm-hmm. Okay, all right. Okay, I'm going to save my comment to the end. I think some of that will probably help facilitate some of your thoughts and with Ms. Edcox. Mr. Walter?
Question, I guess, is why Plan A and not Plan B? What's changed other than what Ms. Blackwell said about the numbers? Haven't changed because we're out of school, but aren't you still having a teacher issue? Don't you have a substitute issue? Wouldn't you still have those same issues on what's changed?
Well, I think several things have changed. We are going to have the antigen test, which will be in schools, which will be able to give a rapid test in 15 minutes to tell if someone's...
To all schools? I'm sorry to interrupt.
So far, it's at 7.
So that's not all, okay. Sorry to interrupt, go.
Also, if we want to do that, we were in B before, and then we went to C. So going back to A is going to be some of the points that Keisha made earlier about being in Plan B is only 2 days a week. You still have kids that are remote, so you still have kids that can't learn. Being face-to-face is going to help these kids to get back into school and be in school at least 4 days a week.
I mean, I don't disagree with that. I just think it's, how do you guarantee safety for our teachers and staff when we can't socially distance?
So we'll save that for Dr. Louder after the board finishes. How's that? Is that Mr. Walker? Okay, Ms.
Yeah, those are my initial
Okay.
questions on it.
Okay, and Ms. Blackwell?
All I got to say is let's do it.
Ms. Carpenter?
Yes. I think you're kind of jumping the gun. Right now, we're at 15, if you go to the state website, we're at 15.2% in Cabarrus County. You've got 65% of the state that are red, 27% that's orange. I I respect every board member that we've got, but right now, I Keisha, the remarks she made, and the individuals that said that, they're just saying generalized. They're not looking at individual counties or individual states and looking at the situations, how a state or a county is. We're considered a red county, and what the situation is in the state or the county you're in. We're in critical times right now, and to be safe for our teachers, for our staff, and to be safe where you condition, looking on Facebook and everything, you're saying, well, what happened during the holidays? If you went on Facebook or everything, you look at all the pictures of gathering, you didn't see all these people that gathered. They weren't socially distanced. They weren't wearing masks, so they weren't following the 3 Ws. That's why you saw all these increases. If everybody were doing what they were supposed to be doing, you probably wouldn't have seen the increases you see. If you see the traveling, if everybody that stayed home and did what they were supposed to be doing, we probably wouldn't have seen the increases we saw. That's the facts of the matter. And so, we got to take the thing serious. That's what has to be done. And so that's why you see the increases that you see. And so that's why the things happen. And so if we want to see this thing stop, the good thing, as Holly mentioned, the vaccine, I think that's the good thing. That's the light at the end of the tunnel. But I think we're jumping the gun to see this to say, yeah, let's do this. But I think you're jumping the gun because we aren't seeing the numbers. And I personally am not going to say, yeah, let's do this when we're not seeing these numbers down, because everybody said, wait till you see percentages below 5 and below all these things before you jump into A. I know that a lot of the individuals have said, yeah, that's what we're going to do. We're going to get to A. And they campaigned on that, and they said they were going to do that. But I am not going to jeopardize the lives of our teachers and of the individuals just to make that happen. I'm not going to do it. Some lives have already been lost, and I'm not going to make any more that happen. I'm just not going to do it. And I'm going to make sure it's safe for everybody before that happens.
Thank you, Ms. Carpenter. Mr. Furr?
Hello. Yeah, I think, the survey is probably one of the most important pieces that we got to get out there. And we got to also survey the teachers as well. But, the parents need to understand, if we come back full force, it's not going to be like it was, in Plan B. The 6 foot's going to go away. It's going to be 3 foot, and the bus rides are going to be, you're going to have to sit closer to people. So, I'm anxious to see what that survey says. And also, too, we need to plead with parents if it's possible, and I'm sure the task force will do that. If it's possible, provide your own transportation, and that takes some of it away, some of the worries away. But I like to commend this board for, and it's got nothing to do with running for office. It's got to do with what's right for kids. And I'd like to condemn this board for the short time we've been together for doing everything possible to do what's best. And don't think 1 minute we're not concerned about teachers, and that's why we need to figure something out there if it's possible. But we've got to get those kids back in school. If we wait till we get to 5% or whatever Ms. Carpenter spoke about, we may never get to that again. It may be 3 years. So I think that number is really insignificant, and we got to give the staff a chance to get it done. Just like my old buddy Mr. Williams, that used to be the board chair when I was on the first time, he said, "Don't bring me any excuses, or problems. Bring me solutions." And I think that's what this task force, I hope, is going to do, is bring solutions. That's all I got.
Thank you. Ms. Sandage, would you like to make another comment?
Sure, I just wanted to respond to Ms. Carpenter. Dr. Fauci said this to 3 different school systems, 1 college and 2 just like us. So he said the exact same thing. He also made mention that, we've got to do what is best for our county. So I do want to make sure that that's understood as well. I think I've had a lot of time over this holiday to reflect on my thoughts around COVID and around how we are doing our children. Our children are suffering for issues that our community is unwilling to fix. We are at 15% now. We were at 13% when we left. And if we continue to hold our kids responsible for what the community decides to do, we are doing them a disservice, Ms. Carpenter. So I think people should be allowed to determine what's best for their families. And if we need to adopt some type of waiver for that, if we need to ask parents to take their kids to school, I'm fine with doing all that.
Okay, so I'm going to recap so that we can kind of move through this discussion. Right now, January the 19th, we will open Plan A right now before the board makes any changes.
That's the motion.
No, I'm just discussing a recap of where we're at right this
What the
minute,
motion-
what's going to take place, okay? So Plan A for EC, OCS, and Pre-K, correct, Dr. Louder, for January 19th? And then all the other grades will open in Plan B?
This is the first that I'm aware of. In Plan A, it would be, if we're in Plan A, then everybody in K-5 would be back 4 days a week.
I think Ms. Adcock wanted to change that to just be K-3 initially, and then add 4th and 5th by February 1st. Was that correct?
That's correct.
Okay. But right now, January the 19th, we reopen in Plan B.
Yes, when we left in Plan B, it was, schools are in, basically students are in twice a week, but as Ms. Sandage said before, preschool students and EC students were going 4 days a week.
Right, that's exactly what I just said. So January the 19th, right now, if we didn't make any changes, everybody would return in Plan B other than EC, OCS, and Pre-K, and they would be 4 days a week.
That's right, yeah.
Okay.
I'm sorry, I must have misunderstood what you said.
That's okay. I just wanted to make sure that the viewing audience understood what we were doing. I know this is a lot of changes. So, for the viewing audience, right now, Cabarrus County Schools, if we did not make any changes, January the 19th, EC, OCS, and Pre-K will return 4 days a week. They will return in Plan A. All other grade levels, K through 12, will return in Plan B. Okay? So with that being said, what's on the floor right now for discussion is Mrs. Adcock's making the change to add to Plan A, K through 3, kindergarten through 3rd grade, January the 19th, effective January the 19th, and then adding 4th and 5th grade, February 1st, which would still leave middle school and high school in Plan B. Is that clear? Okay, great. And to recap the discussion that'll go before the task force.
Can we make sure we do clarify one thing, because you said all EC, and you said EC and OCS, but really what it is now is self-contained EC.
Okay.
They're the ones that are going 4 days a week, so it's a different category of EC student.
So OCS is not included in the plan?
OCS is a self-contained EC program, so when you say self-contained EC, then OCS is in
same.
that category. Yes,
So
ma'am.
really, those two that I just identified separately are okay, they were included.
Right, so the
Okay.
same categories that, the whole time we've been in B, those students have been going 4 days a week, so that wouldn't change.
And OCS is high school only.
That's right.
Okay, so I just want to make sure that everybody understands what the change is going to be. So really, the only thing that we would be changing, effective January the 19th, would be added in Plan E, K through 3.
Also, the EC students that are not
Not
Contained.
self-contained, right.
Correct.
Right. So Dr. Louder, are we describing that the way it should be said? Some of those acronyms get to be a little confusing, especially for the general public.
So are you talking about changing what we're currently doing in B?
Yes.
Yes, so that's,
Is there going to be a vote on that?
Well, we're going to have discussion on it. I guess it's up to the board if we amend the agenda or do any type of vote or add it for next Monday night's business meeting. So I want to be clear on what the change would be first, so we know what we're actually doing. And then we can decide if we want to amend the agenda to add anything or if we're just add it to next Monday night's agenda. So I want to make sure that we're real clear on what is being, actually, it would be all the programs and adding K3 January the 19th. Is that more clear compared to what we're doing now?
yeah, like I said, I guess it depends on what the board is saying they want to do. What we're doing now in B is to bring those students in. If you're going to change or modify that, then there's all kinds of changes that you could make to that.
So I guess what I'm saying is Plan A, on January the 19th, the return of, so you're saying the EC and the self-contained and the pre-K are Plan A now?
They're going 4 days a week in B.
Okay.
So it's a modified.
Yeah, it's a modified, yeah, okay. So if we change that, that puts them, we just add, which Ms. Blackwell's wanting to add the non-self-contained program.
Correct, yes, ma'am.
Correct. All right, so
How many students is that?
I'm not really sure. That's what we're going to have to ask information on. That's
Roughly
what this is.
12% of the student population is special education. So if you want to say 12% of 33,000 students, that's a pretty good guess. It's a little bit less than that, so you may want to say 11%. That would be the population.
So plus or minus 3,000.
That's
That-
right.
Okay, but then out of that percentage, we'll need to figure out who have their children remote.
That's correct.
Right. So we would really need to know
You're going to
that.
have all the details on this. You're going to find out, you're going to know about transportation, whether you're going to be able to provide it. You're going to have all those details by next Monday and be able to say you can do that. By next Monday, you're going to have every bit of that ironed out.
No, we're saying that we're going to formulate the plan of what we need to make that decision. Okay?
Well, if you're going to vote on it next Monday, you're going to have all that ironed out by next Monday.
No, we're not talking.
If you're going to vote on it, you got to have it all ironed out.
So here's the deal. We're talking about getting the teachers and the parents' surveys out, okay? And the January the 19th, all we would be adding is K3 because all of these other programs are already there, except for the non-self-contained. Are you with me, Ms. Carpenter?
No, you're saying they're all going to A. That means they're not going to be socially distanced. They got to have transportation, and you got to do all that. Now, Dr. Louder, am I not correct? You got to have all that ironed out, right?
When I mentioned earlier, I had some concerns. Those are certainly some of them. Yes, ma'am.
So,
And you're asking us to vote on that next month. Next Monday. And all those things have got to be ironed out. And you're saying vote on that next Monday.
Ms. Carpenter, we're talking about voting on making the changes next Monday.
Well,
So-
but that's saying you're voting on it.
Well, so we need the
Yeah,
surveys.
you are.
If that's what the board is in agreement to do, that's what the discussion is on the floor. When board members ask for discussion items to be brought out, that's what we have to do. That's what we're going to define tonight. What information do we need in order to actually make that vote or make that decision? So that's what the discussion is right now. I'm just recapping what we're discussing, okay?
Can I ask a question for clarification
Sure.
purposes? So is it my understanding, so if nothing is done, K-12 comes back in Plan B, right? So is the recommendation for K-3 in Plan A, and then all of the EC populations, are you talking about just for K-3, or are you talking about for 412? To add
One
the-
more time,
I
Brian.
think Laura's request is all,
So the question is, I guess, really, when you say EC, is that for 4th through 12th grade, to add all of the students for 412?
So that's what they're doing now, right? They're not,
So
the,
in K-12, centralized placement students to include OCS are coming 4 days a week.
Right.
K through 12.
Right.
Right.
Now, I think this is really confusing, as you just did not understand that either, especially to the general public. So let's do this. So Ms. Carpenter, what I'm trying to do is to figure out what do we need and what do we need to get done in order to have a vote or to make a decision. So I hear you say you're not comfortable with any of the decision being made this month at all, right?
From what I understand,
Okay.
it wouldn't be, that would not, I mean, you couldn't do transportation and everything on A because we don't have enough bus drivers to do that for A.
Well, that's what we're all, that's what we're discussing, is what are the issues that we need to resolve in order to make that decision. So I'm not saying that we have to vote on this. I'm just saying in order to get there, if that's what this board is trying to do, we've got to identify the problems or the issues that we need to resolve. So I'm not saying that's what we're going to do. I'm just saying what we need to do and the information that we'll need to have to actually, get there. So the surveys, the parents, that has actually come out of everybody's comments, and especially from the task force. So Dr. Louder, how quickly could we get a survey out to the parents and to the teachers? So what Ms. Sandridge was speaking to is two different surveys that we heard was very important. One, transportation, asking the parents, are they going to return their children in Plan A, and are they going to need transportation? And then two, for the teachers, we've heard so many times that there are so many kids that will be kept at home, period, that there's going to be still a lot of remote learners. We don't know what that looks like.
Did we not just do a survey for second quarter?
We've done several, depending on what changed, and this would be a very significant change. So we will have, I think, a significant portion, we don't know the number yet, of people who are comfortable coming to school in B, but will not be comfortable in coming to school in A, and therefore will switch from B to C.
Okay, but we do have a survey, how many students want to come for B? We've already sent that out.
Yeah, well, we pretty much were operating under B,
Correct,
so we were losing some more students as we went into Christmas because more people were going remote, but we have a very good sense of that. Switching to A is a complete and total shift
Right,
of
but
everything in elementary school.
Has the board seen the survey for that, for the one that went out? As I haven't seen it.
For
No.
A?
No, for B.
The last survey that went out was when? What date?
Yeah, the board got, the surveys that we did of the parents when we had the percentages, you guys all got.
Right, but you did a survey after that.
Yeah, there was a recent survey.
I thought you did after that.
No, we did one, the last one we did, we presented to you because you were asking as more and more people were going to see, and you got all that information. So you've gotten the information whenever we've done the survey.
Yeah, the latest information that you got on the percentage of students that were attending was attendance data.
Yeah.
And so as students, over the course of November, it dropped from about 65% in the district attending in person to about 61%. And then that was different by the level. So high school was at around 50%, and it dropped a little bit below 50% before winter break. Elementary was close to 70, and middle school was in the 60s.
Okay, but if somebody opted out in the first semester, they had to stay in Plan C.
Yeah,
If they
so-
go back in the second semester.
They
the
did
only other-
they did do a commitment form right before they were in to
I
say
guess that's
which
what I'm
one they
saying.
were going to do, but that was not based on A being an option.
Right, but it was based on B, so at least we have a
Right.
feel for that.
Can I say something?
Sure.
I think that we're discussing the plan. I think what we are charged with doing is making a decision tonight as to how we're going to move forward, and then allow for the work to happen for us to move forward. I don't know that the continued discussions back and forth is going to get us to a decision tonight. We could be sitting here until 12 o'clock, so I think we need
Yes.
there's a motion on the floor.
It's not a
We-
motion. I don't want that to be construed as a
Okay.
motion. It's discussion items, and that's
Okay.
I think that's what's getting confused. There is no motion on the floor. We need to know what each of you need to know, or information you would like to have to make a different decision, other than what we're in now. There is no motion on the floor. There's no decision. The agenda is not being amended. I need to know what each one of you need to have in order to have that discussion next Monday night if we're going to make a different decision.
And I think we've all said that, and I think we might be doing the work of the task force in this type of discussion is what I'm saying.
Well, the issue would be is if we don't, in a timely manner, ask the staff to get the survey out by the time the task force gets that, we are going to be so close to January the 19th, it's really not going to give parents or teachers a heads up. So I think that's what I heard board members say, that they would like to get at least the surveys out to figure out, because there was no survey done to return us into Plan A. We do not know where parents are about that decision. So that to me is an important piece. The last survey that went out, Brian, when was it?
It was right before winter break about the intent for second semester.
Right, and what were the options?
I didn't develop that, but I know that it was about whether or not you intended to, if you were in Plan C and if you intended to come back in person, that was an option. If you were going to stay remote or if you're going to go from in-person to remote for second semester.
But it's only for Plan B, right?
Correct.
That's right.
It was-
Not an
yes,
option. So
correct.
I think that's where we're at, is the discussion of, should we go ahead and ask for the survey to go out to the parents so that we know whether they are intending to come back in Plan A? And then again, just like I said earlier, do you need transportation? If we put that off to the task force right now, instead of giving them that information, that's going to be, I'm not sure how long that would take, but that's not something that we would get done, anytime soon. So that's my question to all of you. Do we need the staff to go ahead and issue out the survey that says, are you going to return your children in Plan A,
I mean,
and do you need transportation?
If the board's intent is to go to A, then yes, it's certainly
Yes,
like to
because
hear
it's not out there.
Absolutely.
Right.
Well, ask them if they want A, B, or C. Ask them which one, because some of them may say, again, they may be looking at that stuff, the numbers and whatever, and they may still be concerned.
So that was my intent when we had that initial discussion, because we haven't asked the parents, Ms. Blackwell, I'll get you. We haven't asked the parents that. We don't know if they're going to require or request transportation. So I'm not sure we can give the task force an objective if we do not have the information for them to work with. I think doing the survey and giving them the information makes more sense. Does that make sense to you?
But send it to the teachers too, because if you send it to the teachers, they may say, I'm not coming, because they may still be concerned.
And I agree with you, and I think that's what we had some initial conversation in the prior meeting, that this survey would be most important, because it should encompass asking them A, B, or C, do you need transportation, and also to survey the teachers. I think that will be the type of surveys that we need to get all the information, and not just continue to piecemeal, they get an option for C and B, but not A. We don't know if they need transportation. I just think this survey needs to make sure that we cover everything that we really need to know to get kids back in Plan A. Ms. Blackwell?
So a couple of comments. Yes, definitely, I think that we need to do the survey. I've heard many comments about how some of these classrooms are barely full at all under Plan B. I can't imagine that there are many parents out there that if we were in Plan B and they were sending their children to school are going to be upset going 4 days a week versus 2 days a week. I just don't see that really happening. Obviously, they felt comfortable enough sending them 2 days a week. They're probably going to send them 4 days a week. The classroom were already in some cases, what I've heard, almost empty in some cases. So I don't think that there's going to be an overall issue with social distancing, at least 3 feet in these classrooms. Again, this is about giving the options back to parents whose children need to be in school in person because the virtual learning is not working for them. This is giving them that option back as a parent to decide what is best for their children. So I definitely think, yes, we need to send out the survey, send it out to the parents to see who is going to be coming back in these options. Send it to the teachers to get to survey them as well. I also wanted to clarify, and I think there's some question out there about the EC students. So this is all EC students, K through 12. We're talking about 3,900 EC students. Potentially, if we're talking 60% of those coming back based on the numbers that we have right now, about 60% of the people coming back. So this is the number that we're looking at. We're looking at 1,700 children. And so I do want to make it clear, though, that this time around, I don't want it just to be the EC students that are the self-contained. I want it to be all EC students K through 12.
Okay, so what I'm hearing is the most important issue right now is that we need to get a survey done. Dr. Louder, what are your thoughts on that, of a survey that we really need to have the option for the parents of A, B, and C, and transportation, and then one for the teachers?
Yeah, so I have a lot of concern. I think I've made clear before that I have concerns if we don't follow the guidelines of the Health Alliance. I understand that's a board decision, so the board will make that decision and ultimately, I guess, decide whether we're going to follow the guidelines of the Health Alliance. So, but that having been said, if tomorrow we ask a survey of what students and what program they want to come back in A, B, or C on January the 19th. Then if you decide that tonight, then we'll formulate the survey. We'll have to have the survey translated. So best case scenario is that could go out tomorrow night, might be more likely that it would be Wednesday. And then if you give parents, 48 hours or so, then we're talking to go into the weekend, so you have the results back on Monday. If we get the results back on Monday, then you would know, for example, let's say that half of the students that are K3 or K5 will want to come, then that would give the transportation department 1 week to devise all new bus routes for people to be there 4 days a week. So let me give you an example. A student on Monday, and remember right now the bus guidelines are you can only have 22 kids on a bus unless you're going to violate those also. So on Monday, maybe 15 kids ride the bus. I guess before I explain that, I also want to say when we start talking about empty classes and some of that kind of stuff, that all varies by age. So K5, many more students are coming to school in K5 than are coming in middle, and more middle than are coming in high. So high school, I think we were down to about 45%. I had to pull the number, but it was pretty significant that the majority of high school students are choosing C. And then it's higher for middle school, and for elementary school, it's much higher. So as far as people coming in, it's around 70% or so. So if there are 15 kids that come to school on Monday on bus 100, and there are 15 kids who come Tuesday on bus 100, then one bus 100, brings 30 kids to school on AB days. When we start in A, those 30 students that are on bus 100 won't fit on one bus. So now it takes two buses to be able to deliver those kids because they're coming every day. So Mr. Whitaker is going to have to devise all new bus routes for all those, and to be quite honest, I don't think he can do it in 5 business days. So if you're moving to A, you're going to have to give them enough time to be able to devise bus routes for 15,000 students that right now are totally different bus routes that are working. We also haven't run, you're going to be running bus routes 4 days a week for elementary, but 2 days a week for middle and high. So all of that has to be paired because we're on a 3-tier bus system. 3-tier bus system is very efficient for saving money, but it's not always efficient for making changes. So the other thing that's happened is schools right now are remote through the 19th. So teachers are allowed to teach from home. They may not be coming back into the building until the 19th when we're supposed to switch to B. So you would expect a teacher who has never taught in A, set up the classroom in A, being what you guys are now saying 3 feet apart instead of 6 feet apart, and have all that prepared for them to start on the 19th. So a leap from C to A, which the district has never been in A, is a very significant leap to make with 5 business days notice, because again, we're not really going to know who's saying they're going to come until probably next Monday is when you'd be able to get the survey, unless you almost have to give people a couple days to be able to answer that. So there's many logistical problems around being able to turn that around by January 19th, when right now we're in C, teachers and students are operating on remote. It will already be a switch back to B, one that they've already done, so it shouldn't be a traumatic switch, one that they should be able to pick up and start on January 19th. Right now, that's what's in place, and I think what they're planning on doing, I know you guys got lots of emails of wanting people to be in A, and some people saying we want to keep you in C. So right now, that's a switch into B, and then what we said last time when you guys wanted to know what it took to switch from C to B is we told you it would probably take 3 to 4 weeks, 4 being the best, to figure out new bus routes and be able to deliver that. If you change elementary to A, you're going to have to give the transportation department and parents and students enough time to figure out how to deliver all those students to school in a totally different way than we're doing now, because it's going to take more buses to be able to do that.
So I just want to ask a quick question. Are any of our, and you may not be able to answer tonight, but if not, just whenever, are any of our buses impacted by being used for hotspots? Is that one of our issues, Brian? Do you think that there are so many of those being used?
That was discontinued.
Okay, so there's nothing going on. That was a question that came out of that I saw from some of that feedback. So there are no buses being used as hotspots anymore?
That's, once we went back to Plan B, that was discontinued.
Okay.
Yeah,
all
we
right.
were using that to deliver, but at this point, everybody that has requested a hotspot has one, so we didn't need the bus hotspots anymore.
So you're saying 3 to 4 weeks would be February 8th, and at the earliest it would be reasonably able to go to clinic?
Yeah, I think what we said last time, and again, this would be a little more complicated because you're delivering more students, is 4 weeks is a good amount of time to get that all done, communicate that, because parents have to know, hey, I'm not looking for bus 100 tomorrow. Now I'm looking for bus 275, and it might be 2 blocks down or whatever. I mean, bus stops will change depending on who we're delivering and how we're doing it. All of that has to be done, and then communicated out for people to be able to switch. And again, we also need to give teachers some kind of notice that, that's changing to a degree. Their classroom is going to change. So the setup now, which is to make sure that everybody is 6 feet apart all day long, all that changes. And so, what's that guideline going to be? Because again, if it's a K-3 decision or a pre-K-3 decision, those classes by state law are significantly smaller, may have a maximum of 19 or 20. But in 4th and 5th grade, there is no maximum. So if you have 32 kids in a 4th or a 5th grade class and they all decide to come to school, then you're not going to have 3 feet apart depending on the classes. And what we found is that, yes, anecdotally, you have some classes that are like, wow, there's only 4 or 5 kids there. Again, that's much more likely to be at high school. But the other anecdote to that is, well, gosh, I've got 5th grade classes where everybody comes to school. And so if we're in A, then that means Mr. Louder's 5th grade class has 32 kids in it, which means if there are 32 kids in that classroom, there's not going to be even 3 feet of distance. It's going to be the setup that you would have regularly run. So all of that is stuff that you have to give the schools enough time to be able to be ready and say, can we pull that off?
And going back to the health department, when did they say that potentially the vaccine will be available for teachers?
Yeah, so what they told us today is beginning Wednesday, then adults that are 75 and older in Cabarrus County will start to get their vaccine. They can get it Wednesday morning. They are Group 1B. So 1A is pretty much healthcare frontline workers. 1B begins with 75-year-olds and older. And Group 2 would be the first group that includes teachers. What they told us today is Group 2 would be any teacher or educator that is 50 or older. They will be eligible in Group 2. They don't know when Group 2 will begin because it depends on how many 75-year-olds and older come. If every one of those in Cabarrus County shows up, then it'll be longer than if 25% of those come in, and then they'll start to work with Group 2. But even when we get to Group 2, that will only be 50-year-old educators and older, and then they start to move into other groups.
What about underlying health conditions? I didn't talk about that.
No, what they told us today, and Ms. Grimsley can correct me because like she said, there's a lot of information we can kind of check back and forth, was that at first it said educators with 2 health conditions, and this was a state guideline, not a county guideline, that there was nobody that was going to be able to track those. They weren't really sure what counted and what didn't, and so the state has now removed that to say in Group 2, because it's not just educators, there are others, it's 50 years old and older, and that's how they'll manage it because it's much easier to manage than trying to keep up with people's health conditions.
Okay. I still think it's important if we can have the ability to get our teachers vaccinated.
Well, we are definitely moving towards that. And, like I said, I think next Monday will give us better information, more numbers about what's taking place with the vaccines and, how that's being the response, I guess, level from the community itself. Ms. Adcock, would you like to make a comment or add to your discussion item?
I think I would just like to comment that at some point in time, we need to visit this, whether it's now or later. And I think we need to stop making excuses while we can't do it. We know we have to get our kids back in school, and we have to come up with ideas, whether it's out of the box thinking, people are trained for 2 different jobs. I mean, whatever that is, we have to start thinking outside the box and come up with some solutions because our kids have got to get back into school.
Mr. Furr?
Yes, no, only thing I got is, I think what Dr. Louder and the staff needed to know tonight was the desire of the board. And I think he's heard that perfectly loud and clear that the desire is to get the kids in school as soon as possible. And so they got to work on ways to make that quickly. And so he has a big task in front of him, but I think he's got enough intelligent, smart, hard-working people down there to make this happen.
Ms. Carpenter?
Well, I think the main thing, get that survey done. I mean, that's one of the first directions. And again, to follow, again, I've always said follow what the Health Alliance, and y'all are meeting with them also to find out what's going on around the counties around us. I think following what they are doing. A lot of the counties, I know y'all had said what Union, what the other ones are doing, and then following what they're doing, seeing what they're doing around us. I think that's very important too, because we are all concerned with the children. And I've never said I don't want to see the kids back, but I want to see them get back there safely. That's the main concern, and for the community as a whole. So that's where I stand.
Okay, so I'm going to recap. It looks like the main, I guess, important next move is the survey. So I'm going to state that we need to get the surveys out for the teachers and the parents and offer the request of Plan A, Plan B, or Plan C for parents, and if you need transportation. Brian, to me, I guess that's just extending the survey that went out prior to break and just adding Plan C. But there was no request for information about transportation, right?
Yeah, we've added transportation to the surveys that we put out, and we would certainly do that on this one if we were adding a Plan A component.
Did you do that on the last one?
Again, Dr. Hill and her team put that together. I don't recall if transportation was on that or not.
Yeah, it was on all the ones we asked, but what we were looking for, because again, A wasn't on the table, is that you were just saying, are you going to commit to B? So if you are, again, as Mr. Schultz said, if you're on Plan C, we're going to be coming back for second semester for high school, which is different classes at high school. Are you going to stay in C or are you going to be in B? And that was what we asked them. So we haven't asked them A, but we already knew pretty much who needed transportation on B, so logistically, that's been done. Transportation for A is a totally different issue that we haven't participated in, nor have we asked at this point.
You know, I think it's important to always ask about transportation because I think that changes with the roles of the parents, you know, what's going on with them. So I'm thinking that's going to be always an important question because who needs transportation now may not later and vice versa, and those that don't feel real comfortable. So what I think looks differently here to me is the numbers. You know, we said we would wait to see what it looked like. We knew that it was going to go up. You know, the numbers they're doing what they're doing, and we knew that was going to take place because it is after the holidays. I think that was an expectation from everybody. That has happened. Now I think the next set of information that we need to really look hard at before we make a different decision is that going to start coming back down? And then on top of that, we do have the vaccination that's coming forth. So there are a lot of things that's changing here from the decision that we made originally. Whether we make that decision different from now on, I need to hear from all of you what you need, what you want. Are we going to stay with what we've done? Are we going to look at it differently after we receive the survey? The task force, to me, is very important to get information. I assume that would be very difficult for them to make any type of recommendation without a survey result, you know, regarding transportation and or what the wishes of the parents or the teachers would be. I think that would be very helpful to them, to guide them in some of their decision making because they identified that as one of the challenges. So I'm thinking that if the survey could go out and we could ask for parents to identify A, B, or C, and if they need transportation, that's going to give us even more information than the last survey that actually did go out. Brian, do you?
Yeah, and I'll just say I was on I happened to plug into the transitions team today, so it's exactly what you all are talking about here tonight. And certainly the plan is not on paper. This was the conversation, but the conversation of that group was that the recommendation, and this again a conversation, so it's not formal, and I don't want to say it was. It's not in paper. It's not been vetted. It's not none of that. is that 2 weeks in between each plan, and that that we not go from C to A, that there was a transition from C to B to A to allow to work out all the kinks. I think that the transportation, the rerouting, the transit, B's easy. We've done that. We can do it. We know we can do that. We can do that on the 19th. The transition to A would be, there's some things to work through. S&P, transportation, all of that has to be worked through. So that was the conversation today in that group, and I just happened to be in on that meeting for about 15 or 20 minutes. So that was, and again, wasn't a formal recommendation that they made at all.
So I think that's where we are. And
Let
I'm
me
sorry.
make a suggestion of just, again, based on logistics, and then the board obviously can do what the board chooses to do. So if we're coming back right now on January 19th in B, unless you guys decide to make a decision. What Mr. Walter just said, the 8th, I think we have scheduled a teacher workday on February 15th. Is that right? Is that a Monday?
That's correct. That is
Yeah,
correct.
so February 15th. So if they come back on January 19th, which is a Tuesday, the Tuesday after Martin Luther King Day, in B, with the self-contained groups, in other words, in B the way it was before, then if they come back in B, and it sounds like to me that this board really wants to set a date for A. The other thing I would say that if we put out a survey that is not specific, then what you get back from the survey is, well, when is that going to happen, and what is that going to look like, and what is it going to do? So, again, if we're coming back on the 19th, the 15th is a teacher workday, the 16th, I guess, is that Tuesday after. That would be approximately 4 weeks from when they came back. So if you come back in B on January 19th, and then you said, well, what we want is A, because I think I keep hearing the board say, give us a date for A, then that would be a logical time, especially a day after a teacher workday, that you would know 4 weeks ahead of time we're coming back. It also would give us 6 weeks post-Christmas or post-New Year's to hopefully find out what do those numbers look like, how bad are they, or whatever they look like. But logistically, I think that's doable. I can't sit here and tell you that it's not doable 1 week earlier or 2 weeks earlier, but it's not making excuses to say that they can't make up transportation routes for 15,000 people in 5 business days. It's just probably not doable. But if you want to say, well, what we want to do is come back in B the same way we were before, moving towards a transition to A, that date would be really good with the teacher workday to begin in. That ultimately kind of starts up from there. Now, again, I guess the board has to do it, but decide what they want to do. But logistically, and the way the calendar is made, that makes a lot of sense. And then the survey can be, this is what we're going to do, and do you want to come back in? Because I personally think there are people who are not comfortable coming back in A tomorrow, but they might be 6 weeks from now when we've kind of gotten over this surge and possibly have 3-4 weeks of vaccinations that have begun with some of our employees. Now, again, that's all kind of up in the air. But I think you'll get a better result from that if you say it, or if you say, no, we're going to do it tomorrow. But if it's generalized, you're going to get a lot of people, what happened last time is to say, well, we can't really answer that. What does that look like? Because are there going to be 30 kids in my class, or are there going to be 13? Because there are parents that, as I said, that I've certainly heard from, and faculty that are very comfortable in B and aren't going to be comfortable in A. So somebody who is coming 2 days a week is not going to come 4, and they're going to switch to C. So we have to adjust to all of that and then be able to deliver people to school.
But you're telling us it's doable by the middle of February?
I think the timing of that, especially with a work day, is you say, we come back in B with all self-contained, and then you decide if that's going to be K3 on February 16th, or if that's going to be K5. I mean, those are all things to decide, but regardless of the date, I think we have to be a little more specific, or we're not going to get great answers to the survey.
I'm supportive of that.
So I've got a question, Dr. Louder. So what do you think would be easier for you guys to do if, let's say, we started on February 16th with K through 5? Is it easier for you to plan it all at one time, K through 5, rather than splitting it up to K through 3? If we're going to push it out that far, should we just go ahead and plan for all EC and K through 5 to come back
Yeah, well, I think what
that
people are
day.
going to tell you is that, and I think what the faculty is going to tell you if you go out there is in K3, we're pretty comfortable even if all the kids show up. Because if there's 20 kids sitting in a class, which is pretty much the limit, it's right in that range, then we may not can get 6 feet for everybody, but we can probably get 5 or whatever that boils down to. Where our elementary people are very concerned is in 4th and 5th grade because those class limits don't exist. So as I said before, if you have 32 kids in a 5th grade class, there are a lot more concerns about social distancing than if I'm in a class of 20 in K3. So I think it's less about being able to do it and more about, are we going to kind of honor that 4th and 5th is in a totally different category than preschool through 3rd grade, because those numbers make socially distancing pretty acceptable. It may not be ideal, but it's okay. 4th through 12th, social distance is off the table if you go to a Plan A.
Does that do anything with the encore teachers and classes?
Well, wait just a minute. I want to make sure that we're all clear because we can't go Plan A for
You-
middle school and high school.
Right.
That's not even doable.
But the class size is the same for 4th and 5th as it is for middle and high.
Right, but I don't want the general public to think that's even an option.
Right.
Because it's definitely not. Middle school and high school can't at all.
Right.
Right. So,
But that's where you gotta get creative and use the cafeterias and the gymnasiums or whatever, square footage you got to make it work.
right. So I actually want to give, and I apologize for being on my phone. I'm sure people are going to be emailing me and texting me immediately, but we have the teacher liaison who's texted me and said she would like to make some comments. We have her virtually with us. Miss Wagner, are you there?
Yes, I'm here.
Okay, I want to give you some time. You go right ahead.
Okay, great. Good evening, everybody. I hope everyone had a wonderful winter break and a happy new year. I did want to start off just to say thank you to all the teachers and then, of course, the families who are supporting across the district, who worked very hard to make today a success for students across the district. I'm looking forward to all the teaching and learning that's going to take place over the next 2 weeks. So as I've been listening and kind of thinking about all the ideas that have been thrown out, and as the board and the task force begins to consider the next move for CCS students and teachers to return to Plan B or C, I don't have any comments, but I do have questions and ideas for the board and the task force to consider. So most of these concerns have already been mentioned among the board or Dr. Louder, but I wanted to reiterate them as the teacher liaison, that these are concerns from my perspective as well. So the first question or kind of idea for the board to consider was just really that plan to support administrators with teacher coverage and substitutes. So when students are coming back in the building, they're going to receive high quality instruction that's standards-based from an adult that's in a safe environment when in the building as much as possible. Before we moved to Plan C, that was a huge concern for a lot of teachers and administrators and schools across the district. So please look into a creative and innovative solution to ensure that we are going to have that face-to-face coverage. Secondly, ensuring that teachers are going to continue to receive adequate and legal amount of planning time when returning to Plan B or A, as at present, when teachers return back in Plan B or Plan A, we are asked to teach in person and live stream remotely simultaneously. So really, when you're talking to the teachers on the task force, take into consideration the time and the skill set that it takes to adapt these lessons and activities to a digital setting, and make sure that the lessons and activities are engaging for students in person and at home. That does take a significant amount of time and lift. So please utilize the teachers on the task force to have an understanding and a perspective of the amount of preparation and planning it takes to prepare remote content that's innovative, engaging, and collaborative, which is what our students are going to deserve if they're learning in person or at home. So if we're going to be asked to do both, I want to ensure that teachers are going to be given that planning time. That Friday has been critical for my team when planning these engaging lessons, when preparing to meet with students one-on-one, preparing interventions, all of the extras that students deserve, whether they're at home or in person. You need to give us the time to plan and do that lift. And then finally, this has been discussed, but please consider the impact of social distancing amongst schools when discussing returning to Plan A in elementary. So as I've stated at the last board meeting, we have classrooms on my grade level and mobile units in K3 that will not be able to ensure 3 to 6 feet of social distancing if all of their students choose to return in Plan A. As Dr. Louder stated, my colleagues in 4th and 5th grade, I know colleagues who have an upwards of 30 plus students, and every classroom size is going to be different depending on classroom size and building. So as Mr. Furr said, utilizing creative solutions such as using all square footage in the building, making it known that, if you're going into that mobile unit and there isn't a creative solution, we are not going to have 3 to 6 feet of social distancing, and we cannot guarantee that in Plan A, and we were able to guarantee that in Plan B. So I don't have any personal opinions or perspectives on the decision that should be made. These are just things that I think that you should consider and would be very helpful from a teacher's perspective to have a clear plan and expectation in place when returning back into the building. And I do just want to thank all the board members and everybody who's on the task force who really, working innovatively and collaboratively to do what's best to get our kids back into the school building safely, which I think we can all agree is a #1 priority right now. So thank you guys so much, and I hope you have a great evening.
Thank you, Ms. Wagner. Mr. Schultz, I hope you were... Absolutely. That's a lot for the task force. I'm going to ask Ms. Wagner, if you will, send those comments to me, please, and to Mr. Schultz so that we can make sure that those requests are listed categorically. Can you hear me, Emily? Okay, great. That would be awesome.
Yeah, I'll send a follow-up email, absolutely.
That would be great. Thank you very much. So I think one thing that would be very important for the board, Dr. Louder, is to see the survey, because I'm not sure we ever see the survey before it goes out so that board members can agree that that's what they all had in mind, or that we've agreed that that's the information that we want to see. Board members, I will ask you, would you like to have them to email us the survey before it's actually sent out?
Or the board can write the survey, and we'll administer the survey that the board wants us to ask the questions for.
I personally think it should just state and ask the parent to decide A, B, or C. I'm not sure if giving them a 1, 2, or 3 option is beneficial, and if transportation is required. I don't think it needs to be very in-depth. I don't think it needs to be cumbersome, but I just think it needs to state their intentions and if they need transportation. Ms. Adcock?
I would also include in there if the parents were able to bring their kids to school, if that was an option, because that may be something that has to happen.
So you mean
I
not...
think Dr. Louder's idea was good about possibly putting for A. If he gave the thing that possibly it become effective in February, that A possibility, I think that was a good idea.
Ms. Carpenter, I think you're going to have to clarify your statement.
So
What
would
was...
that eliminate the need for the survey, right?
Say that one more time.
If we set a
What he
date for the
suggested-
15th,
Set a date. Is that what you're stating?
Yeah, like
Yes.
with A possibility, it be effective February, for them to know when A
It's gonna
could
take place.
possibly be effective. Like B, it be B, A, C, B, and effective, A be effective, and give in parentheses the date A could be effective. I think if they knew when that possibly A could be the effective date for A, that might help them make that decision. Because if they do that survey right now and they're seeing the rate being 15.2%, they may say, I don't want them going into A right now, or my child going into A, or, the rates being really high and everything. They may not even consider A.
Right, that's what I was saying. Right. Ms. Carpenter, I understood what you were saying, and that's what initially I said. If we state that, we see that was my concern, that the numbers are where they are now. We knew that was going to happen, or projected it probably would happen after the holidays. And then as they come down, hopefully, and we get a little closer to that return date, maybe that will look a little better and their comfort zone will be. I guess we have to decide as a board, when do you want the survey to actually go out? Is it now during this time that people are hearing this and getting this information so that it gives them a heads up, or we worry that they may make a different decision 3 or 4 weeks from now? I mean, that's what the board needs to decide, timing of the survey and what it actually needs to state. Ms. Blackwell?
Just had a quick question, and this was something that Ms. Sandage kind of alluded to a little bit earlier. So now that we're having this discussion about potentially moving into Plan A and then the classroom sizes, I think you mentioned something maybe about a waiver. Is that something that, Mr. Shaw, maybe this is a better question for you. If parents, let's say, are, comfortable if the classroom size, because like you said, Dr. Louder, it depends on the grade, it depends on the class, it depends on many things. Is this something that parents would need to sign like a waiver stating like, I understand that my child may not be able to be socially distanced at all times based on the classroom sizes? I'm okay with that, and sign that. I don't know how that would work, but is that even an option for us?
Yeah, I'm not certain that has any legal impact. But I think it's probably a good idea to have some just warning for decision-making purposes. You understand that the school board will try to do what it can, but it cannot guarantee this or that. I think for strict liability, we're still under an immunity regime established by the state. While the emergency is on, businesses are not going to be liable for COVID-related illnesses. To me, it's more a matter of transparency with parents and parents to understand what the situation is and take full knowledge so they can make informed decisions.
So maybe a disclosure statement on the survey that states that they made
I think that as long as, I don't think we need a signed waiver, signed release back, but the notice to the parents somewhere, whether it's this one or later on, I don't know what communications there will be, but there's some notice that the school district will take efforts to distance but cannot guarantee.
Is that good for you? I think a disclosure statement makes a little bit more sense.
Yeah, I think a disclosure statement would be great on the survey.
Okay.
To let them be able to make that decision.
Okay.
When they're filling it out.
Okay, Mr. Walter?
Yeah, did we want to put the grade level of the person answering survey first, second?
Say that one more time.
Grade level of the person answering the survey, do they have a child in the category of the kindergarten through third, or?
So we will only be able to return children through grade 5 in
Right, but
Plan A
we're surveying
anyway.
everybody. Are we just
surveying
surveying K through 3?
Well, maybe that's a discussion for the
So
board.
if we're surveying
at this
everybody,
time-
it would be nice to know which grade level they're
I
responding.
think we have to survey everyone, because even though we're not allowed to return middle school and high school in anything other than Plan B, unless that gets changed at the state level, that we still need to know the transportation piece. So I'm not sure, does that look differently for parents that are elementary versus middle school and high school, where we're not allowed to return them in Plan A? I mean, what, Brian, maybe you and Dr. Louder need to give us?
Yeah, I think, and Brian, you help me make sure I'm not missing anything. I think we know who needs transportation 6 through 12, right? And if nothing's going to change, we can, it might change a little bit. That was what the commitment form that we sent out before was to say, are you making a change from B to C for second semester? So the bus routes that exist now pretty much are going to stay the same. We know who needs transportation, and those 2 tiers are not going to be a problem. So the issues are going to come in first tier with elementary. So I don't think we need to ask anybody but elementary school. We have all the
Okay.
information we need, but if I'm missing something, then jump in there.
So you're saying just survey the elementary age parents?
What about the EC kids that are 6 through 12 though?
Yeah, well, that's a whole different model if that's what we're going to do. Like, that's a big change. And so we I think, know, I guess what we wouldn't know is 6 through 12 that aren't self-contained that need transportation 4 days a week if you make that change.
Right. We need to make sure that that's done also.
So right now, those have already been surveyed anyway, because they're already in 4 days a week. I want to say modified A, that probably.
Self-contained is, but if this board is going to decide to bring 6 through 12 EC students back that aren't self-contained, then they have not had a 4-day-a-week
survey.
option presented to them, nor transportation option. That, yeah, we would have to find out, so it would, I mean,
So the
ultimately
survey would
just
need
go
to go out to them as well.
to EC students, if that's what you're going to do. I also want to say, if we're going to discuss that, though, is if you're going to make a carve-out for special education students, there are numerous other students that I would think you have to put in that group. So, for example, students that are ELL would fall into a category to say, well, why don't they come 4 days a week? McKinney-Vento students, some people would make a case for, or have us, why are they not 4 days a week? And so you begin to start asking lots of groups to say, well, if ELL students, for example, that, speak a different language, why are they any more, or why are EC students any more or less? And so you have to ask that question for many more groups besides just exceptional children. So again, I know the board is now just talking about one group, but there are at least 2 or 3 other groups that have significant amounts of students also, that I'm not sure how you would carve out one group and not include the
But
other
they all have
groups.
IEPs, right? So
IEP? If they
An
all
EC
have an
student
IEP.
has IEP, but an ELL student has, roughly the equivalent, which is to say, what they're working on. So there are federal mandates, there are state mandates of educational services that they're supposed to receive that are not much different than an EC student. So if the board wants to say, well, exceptional children are in a different category than this group of students, then you can say that, but I'm just going to say there's going to be lots of questions about those.
Okay.
but aren't we doing that now with the self-contained?
What's that?
Well, we're doing that now with the self-contained.
Because the level of services for a self-contained student is much more significant. So I'll just give you an example of a high school student, because you mentioned OCS. So a student that's in OCS is pretty much in EC services all day long. But you may have a student who's LD in math, for example, who only has an inclusion EC service just first period for math. The rest of their day, they don't get EC services. So very different level of that. The reason that those were put in was to say, well, they are there. Same thing with ELL students that are there. Some of them may have services all day. Some of them may get pulled out for a certain period of time. So all of that becomes part of an equation that probably needs to be on the table if you're going to start bringing certain groups of students back and not others.
So let me ask you this. Do you have an idea of what that number would be? Like how many more children we would be talking about?
I don't have the number off the top of my head, but we can send it to you tomorrow.
Okay.
And again, it would say, are you asking us to put forth, because some of our principals may say, well, okay, there are EC students, there are 504 students, there are ELL students, there are McKinney-Vento students. All of those you could certainly make a case for are a very needy group of students that, would be much more than 3,900 students. It might be 10,000 students when you're finished with that number.
So I guess I have a quick question, just to make sure we're on the same page. So if any of those program students' ages fall in the middle school or high school category, even though they are not allowed to return in anything other than Plan B, do they, because of them being classified in those groups, they still can return in Plan A? I want to make sure that we're clear about that.
So ask that one more time. I'm not sure I followed.
So the students that are now in Plan A, or the modified Plan A.
4 days a week.
Right, 4 days a week. Are they all age levels, including middle school and high school, even though middle school and high school students are not allowed to return in anything other than Plan B? Does that program allow them to return the 4 days a week?
Yeah, I know the EC, the centralized placement students and the OCS students are 4 days a week in 612.
So if we surveyed, we really couldn't do a carve-out if we're trying to put the programs with the elementary age children, correct? That would be very difficult, or not.
Can you clarify that question?
So if we're talking about not just sending a survey out to all parents, just to get all the parents included so that we get A, B, or C, their decision on which plan, and or transportation. If we're trying to carve out, because we're saying it really only impacts elementary because that's the only group we're allowed to return right now to Plan A, but yet we have the special programs already there, can you pull those? Did you survey those? I guess that's more the question. Have they been surveyed? Because you said you already know from 6th grade up what's Plan B and C and whether they need transportation. Are those groups included in that you already know that?
The groups that are already attending and.
So they really wouldn't need to be surveyed, correct?
Well, if we're going to add all EC students at 612, or if we're going to add other groups at 612, we'd have to ask them.
So I guess y'all are going to have to tell us what is, we're not real sure of how your surveys work. Can you carve out specialized programs, parents and elementary, and do those carve outs? Or is it easier just to survey everybody again and just do it again?
Can I ask a question?
Sure.
So this is very disheartening to me, just listening to all the questions and the comments and the go back and forth. I think what we're charged to do as a board is come up with what we like to see for our school district. And Dr. Louder and his team tell us what is possible, how we can meet at least even halfway. If we need to talk to some legislators, if we need to ask for some leniency somewhere, if we need to ask from our community for something, then we start doing that. We've identified that we want to get our kids back in school, and we've asked for K through 3. That's been the discussion, and I think, again, we just have to make a decision as to what we want, and then let Dr. Louder go do that.
Well,
I think that there has, I'm sorry.
I started to say, I think that's what we're doing, and it is a hard discussion. But we do need to decide tonight what the board's wishes are. We are discussing that. Legislative agenda is on our calendar to have that discussion, but that's not anything we're going to do in the next several days. So I guess this is what...
So I'm not worried about a lesson plan. We have to meet our kids where they are at. That's what I explained earlier today. What I'm worried about is getting them there. And then what I'm saying in my earlier comment was that we're having all of this discussion, and we shouldn't be, because we should have already done this as a board. We've been able to get our kids back in school on Plan A for at least K through 5 for months now. So we are furthering along a process, and we don't have to. So again, I'm just going to make it very clear. All we need to do is say, this is what we want, how do we get it done, and then go do.
So you tell us what you want as one board member, Ms. Sandage. You tell me, you verbalize that.
We've already said we want to get our kids back in school.
Okay, now tell me a
We can
date.
get K through 5 back in school.
Okay.
So now we've got a task force who is working on the dynamics or the suggestions to us to get that done. I mean, that sounds simple to me.
Dr. Louder gave us a date, so we have a date.
Right.
That sounds simple to me. I
Well, we
think
don't-
we're making this a little more confusing.
But what we
than
don't
it
know
needs
is, can we include the EC kids or not? Is that allowable? I
So
think-
I'm just going to ask each of you to tell me what your takeaway is right now of what this board is supposed to be doing tonight. Because these were discussion items that you've asked for and that you have asked me to identify dates or for us to allow discussion for dates. That's the discussions we've had. So I need each one of you to tell me if this discussion is just about let's figure out the survey and let that be done and let that be that part, that's good. I just need to know what the board wants to do or not tonight from your conversations you've had with me. You asked me to put stuff on the table to discuss it, and that's where we are. So I need to know exactly what you want done tonight. So Ms. Blackwell, I will start with you.
All right, so first thing I would like to do is make sure that we send out a survey. I would like to make sure that it is done to all K through 5 parents. I would like for it to ask the question of Plan A beginning on, I believe you said February the 16th, for their children. I would like for a survey to be sent out and carved out to all of the EC students, parents, K through 12, to see if they would need transportation and if they want to send their children back to school 4 days a week as well. Those are my main 2 objectives.
I second that.
So Mr. Walters, or anything else? That's it. Ms. Sandage?
I'm going to third that. The only thing I would ask is, for me, when it relates to our staff, health equals virtual to me.
Say that one more time.
When it relates to our staff, health equals virtual to me. So I think I talked about that earlier, and that's that teacher survey.
Okay, so you're asking for not only the parent survey to be sent out, but a teacher survey as well?
Correct.
And the teacher survey is going to ask what?
I want to know how many teachers are having to work and they shouldn't be working because they've got significant health issues.
So, I mean, are we going to ask them anything about whether they want to be?
Well, we should already have this data from HR, correct?
Dr. Louder?
I'm not sure what we're asking teachers, to be quite honest.
You're going to get the same answer if you got A, B, or C, right? You're going to get the same thing.
So you're
Correct.
asking for teachers just to answer the same
Correct.
question?
And then we're able to determine if they've got a significant health issue that creates a burden for them being in the school system or in the classrooms.
Mr. Shaw, I think I need, is that doable on a survey? I mean, what would be one's opinion on them having some type of issue?
Well, if
might be
someone's going to pick
different?
C, you would think that they've got a reason for that.
I just think they need to answer whether they want to be
A,
in.
B, or C.
Right, exactly. And maybe not disclose any type of health information, because I think that's going to be, I'm not even sure how we would identify that. Ms. Sandridge, would you be okay with that?
Yeah, I don't want them to identify if they have health issues. If they've identified C, I'm just going to guess that they would have already put in an HR and said whatever have you or another. But I'm saying out loud that to me, health equals virtual. So if they have significant health issues, then they shouldn't be in the classroom. That's what I'm saying.
Okay. Ms. Adcock?
I'm in agreement with what everybody else has said as far as the survey goes, and I'm also in agreement with going back into Plan A on the 15th or the 16th, whichever day Dr. Louder said.
And you asked for something else in transportation, other than if they require transportation. What was your additional piece?
Would the parent
Be
be
willing
willing
to-
to bring their kids to school and
Right.
pick them?
Okay, okay. Ms. Carpenter?
Okay, well, ditto what everybody had said, making sure the teachers say what they prefer, and and I think that's the way we can do it, is saying whether they want to be C, B, or A. Two, can we have a column for the teachers if they've got any suggestions? You know, some of them have put some really good stuff out there, so I don't know if we can have a comment box for them. Same way for the parents, if they've got any suggestions. I don't know if we could do that, but if they've got any other comment, have a comment section maybe on both of them. I mean, they may have some type of comment, but have something. If they do want to put some comments, have a comment section or a suggestion area in
Okay.
case they do.
Okay. Brian, I think that is really a good idea. I don't think we've ever added that to a survey to have a comment. I mean, I'm not sure how you would.
But I just want to make sure we're asking all of our teachers, do you want to be in A, B, or C? That's the question. And if 90% of them say C, and 90% of the
Which they
parents
would.
say A, then we're going to say, well, we
You're
want
going
you
to
in
work
A.
anyway. That's what we're going to tell them, right?
I just want to make sure, so we're just, the teacher part is to say, do you want to be in A, B, or C? That's the question, and then a place for comments.
So I think it's real important that we really do understand where parents are right now and where teachers are. I don't know how we're going to make decisions on anything if we do not know where parents are and where teachers are. And I think from that information, we do have to figure out where we go from there.
we
But to
gonna
me,
ask
that first piece is
Or
finding out where they are.
Support staff?
I'm
Okay.
sorry?
Support staff, bus drivers, custodians, those folks as well?
Are you saying that you want to add that to the survey?
Well, you may get a different response. I mean, why are we excluding them necessarily? They're all part of getting kids back to school.
Well, the bus drivers especially, because we got to have them for transportation. I think they need to definitely be on there. If we don't have bus drivers to get them there, we're up the creek.
So, Brian, have y'all ever surveyed support staff or the bus drivers or?
No.
Okay.
I also, can I make a comment real quick?
Sure.
I think making these assumptions that, like, let's just say 90% of the teachers are going to put C and then 90% of the parents are going to say A is what's really fueling a lot of the separation between it's us versus them, which is not our goal at all. Our goal is to really get the numbers and get the information so that we can make the best decision for the county, not
Agreed.
for the Health Alliance, not for, the we are trying to do what is best for these children. And so when we make assumptions like that and throw that out there, that is creating a negative environment that we don't need to create.
So again, I'll just say, I think that is the foundation of our decision-making process with this, is that we have to know where the parents are and we have to know where the teachers are. And then look at that, whatever that looks like, we can move from there. But to keep guessing is just not, it really is not getting us anywhere. So Dr. Louder, do you feel that everybody is clear on what those surveys need to look like and the information being requested?
I will probably have to watch the video back, or in other words, I would love for the board to send the questions and we'll ask them, because what I worry with kind of where all this went is that somebody to say, well, that's not right or that's not it. So if we just have the questions, then I'll be glad to ask them.
So how about I'll just write the survey questions and send it out to all of you tomorrow. Will that work? Because I'm just hearing, all we need to know is from the parents, are you A, B, or C, and do you need transportation, and would you be willing to provide it if necessary? And then we may have a disclosure statement that says there may be some social distancing issues that might take place according to the numbers that return. Is that good for all? And that we need to survey the teachers as well. I'm assuming that we can survey the bus drivers. I'm not sure how we get all of that information, if that's a piece that the board wants. I guess, Brian, you're going to have to tell us or ask Art how that would be done. I mean, I'm assuming that both bus drivers are there.
They've been working.
They've been working. I mean, I'm not sure that they don't change with that. I mean, they're either driving the buses in whatever plan we're in, correct? I mean, I'm not sure what benefit that's going to give us.
Yeah, I just want to say, like, for me, health equals like virtual for everybody. If you've got significant health issues that are a dilemma for you being in contact or in close contact with other people, we need to take that into consideration. And I am just guessing that we already have those individuals because they've probably already filled out a form or a request for whatever. And virtual, I'm just saying that they shouldn't be in front of kids. That's the bus driver, the custodian, the teacher, that's everybody.
So
It's a staff survey.
Right. So
It's
my
staff.
thought is, we already have identified with the task force that bus drivers are an issue anyway. So we know that's an area that we're going to have to concentrate and focus on anyway. So I'm not so sure a survey to them will provide that much additional information. To me, the survey for the parents and the teachers is the most critical at this point in time, Mr. Walker.
Do they have an email address? It shouldn't be a big issue. Or do they not?
They do have an email address, but they don't always have daily access to that. It just depends. So they may have it, but getting access to that is not, obviously,
You never get everybody in a survey anyway.
So
not
let
part
me-
of their
one
job.
Right. Ms. Carpenter, hold just one moment for just a second. I just want to make sure, because we do need to wrap this up and move on. My thought is, right now, if the board can give me a consensus that the teacher survey and the parent survey is the most important. Can I get a hand? Ms. Carpenter or Mr.
Yes.
Furr, are you willing to?
Yeah, you got my hand.
Okay, thank
Yep.
you.
One question for the teachers. I know I got a couple emails, and one of the questions, a couple of the teachers said they didn't get adequate PPE. That could be one of the questions. Do you feel like you get adequate PPE? That could be one of the questions.
Well, just knowing a lot of the feedback that came back, I did not see anything that anyone referenced PPE, because we have a ton of inventory, correct, Brian? That really should not be a problem at anywhere at any school.
Caroline, if you have them, let them make a comment, they can put that down.
Right. I mean, that may be an email that, I'm not sure who you got that from. I don't remember seeing that, but if you can forward that to me, we can take a look at it. But that should not be an issue, correct? I don't even want that out in the community. We have tons of inventory at every school. There is nothing that they should be short on. Correct?
That's correct.
Okay.
And if you start talking about PPE, then you have to define it.
Mm-hmm.
And then it's up to everyone's interpretation of what's adequate, what's the CDC's recommendation, what's the Health Alliance recommendation, what's the state's recommendation, and then it becomes, and there are recommendations from the Department of Public Instruction and NCDHHS, so we
Right.
already have recommendations on that.
So again, I'll restate, we have a ton of inventory, correct?
Absolutely.
Yeah, okay. So once more, I'm going to recap that the surveys that will go out, one for the parent, A, B, or C, transportation, yes or no, and would you be willing to provide it if necessary, and a disclosure statement that there may be some issues with social distancing and according on to the responses we receive. Is that good? Okay. And then with teachers, same thing, A, B, or C, transportation's not an issue. I mean, maybe they need to understand about the disclosure of what's going out to the parents about social distancing, but definitely just A, B, or C.
And let's be clear who these surveys are going to, K through 5, and then EC parents, K through 12. Is that right?
As long as, I thought we were back to everybody was going to get it, just because
Okay.
it was starting to be a problem, so I was
Okay,
assuming.
okay.
And I really, to be honest, my one board member here would like everybody to get it again, just so that we're clear that everybody got it and nobody can say, well, I didn't get it, you know. I think we'll start a whole chain of problems with that. Let's just send it out to everybody and just be done. I think that would be easier for the staff as well. Brian, do you agree? Versus trying to carve out all those individual programs, K-5?
Probably versus carving out, yes.
Yes, okay, great. So is everyone good? Are we good now? Okay, very good. Brian, I think you can actually leave us for a few minutes. But you're not, because we've got policies.
Yeah, but I have to grab my giant notebook, so I'll be right back.
All right, sounds good. So next, board members, we will move to items under number 5, 5.01, policy revisions for approval on second reading. And we're going to have Mrs. Burns. Are you with us? Back there. And board members, I'm going to cover these just like I have been doing previously. There has nothing been sent that I have seen, any questions or comments. So I will just read these and move through them just like we've been doing, and then I'll hold comments or questions at the end. Okay, so we're going to start with policy number 1740-4010, student and parent grievance procedure. Policy number 1742-5060, responded to complaints. Policy 1750-7220, grievance procedure for employees. Policy number 2120, code of ethics for school board members. Policy number 2121, board member conflict interests. Policy number 3102, online instruction. Policy number 4040, 7310, staff student relations. Policy number 4331, assaults, threats, and harassment. Policy number 4150, school assignment, transfers, and program choice
I think I
enrollment.
had a question on that.
Can you hold it till the very end? Okay, good. Policy number 4154, program choice, expectations, and continuation. Policy number 4340, school level investigations. Policy number 4600, student fees. Policy number 5070-7350, public records, retention, release, and disposition. And policy number 7335, employee use of social media. These will be placed on the consent agenda for our Monday night business meeting. Now, are there any comments or questions? And please reference which policy number.
May I add, just, so we did not, this is second read, so we did not get any public, these have been posted, and we did not receive any public comment or feedback.
Right.
Thank you for that clarification. I had three policies I wanted to question on. 4150, you have, on page 2, you have 2 number 1s. Is that supposed to be there? Page 2 of 10, that's under C.
No, that needs to be corrected.
Okay.
Okay, and then I can't remember what the reasoning was behind number 6C. Can you explain that to me one more time? The item in red, page 3.
Which policy
So
was
it
that?
allows the students, that allows the students to live in the,
4150,
to attend the program in the school where they are zoned.
so we didn't have that before?
That's correct.
Okay.
Are you good, Mr. Walter?
I'm good with that.
And that was your only questions?
And I guess the
You
other one
said
was
you
a
had
brief
three.
question of 4154.
Okay.
Is there a reason why we didn't specify the ID diploma program as we did in the previous policy? Or is that just, should that be in there or not in there? So 4150, we added it.
Yeah. Ms. Burns, did you receive anything from Ms. Szymanski on that?
I think it's considered a magnet program. I think, are you talking about the first paragraph?
Yeah, I'm talking about the first paragraph. And then if you go back to 4150 on page 3B, it was just inconsistent, that's, or I just read it wrong. So that's just a question, not,
So we'll just,
I'm okay with the,
I think the 4150 is talking about schools that have a specific time when students can enter. And
That's right.
4154, those are included in the magnet programs.
Okay.
We can change that if we need to.
I just, for consistency, that was my only question on it.
So,
Yeah,
Brian, can
the-
you speak to that?
right, the IB diploma program actually the formal program starts in 11th grade. Everybody calls it DP, diploma
All
program.
right, so it wasn't oversight, just, that's fine.
Right.
So is that clear, Mr. Walter?
Yeah.
And you're okay with it? No correction necessary or
I'm
needed?
fine with it, just,
Okay.
Yeah, and then I'd also add on 4154, that we did add the cross-reference that Board Member Walter brought up last time, the cross-reference to our school board policy 3405. So that was added from our last meeting.
So the corrections have already been made other than 4150 where there are two number ones?
Correct.
So you're going to make that correction?
We will.
So is everyone okay with those corrections and adding this to the consent agenda for next
I
Monday?
had one other question on 4340.
I'm sorry, which one?
4340,
Okay.
and that I guess is for Mr. Shaw. On the first paragraph, do we ever have the attorney do an investigation? 4340, first paragraph.
You're asking whether,
Yeah, should
should
the
there be a
board attorney or
reference
school,
to the board attorney as a
school system
possible-
attorney be added to that, or is it is the way it is?
Are you suggesting like, something like?
I'm just saying, you're not a school administrator under this policy, right?
It probably depends on what people mean. Usually I'm not considered a school administrator. But,
Yeah, I don't have any issues with it, just it's a question for clarification if
Yeah,
that's.
that's my point. What's it matter?
So, Mr. Walter, I would really ask that you email these to us before we get here. That would be very, very helpful, especially since you
I will
sit
try to do
on
that,
the
but I did
policy
read that
committee.
this afternoon.
we could say is conferred on another person under a particular board policy. And that would just be a blanket term.
I mean, I guess you need to clarify what your issue is with it.
The question is the school attorney ever involved in an investigation? And if so, the school attorney should be listed in the policy. If
So
not,
you're
then
asking to add him, right?
If that's, but I don't know, I have no idea. So
Well, we know that they're involved for sure. I mean,
for
that's,
the school level investigation, I don't know. So,
well, I'm thinking that they call and ask,
okay, so if that's the case, then maybe we should add board attorney to that policy.
right, right. So, Brian, are you good with that?
Yes.
Okay. I mean, if it needs to be clarified, and that's what I'm hearing you say, we definitely know that probably does take place. I think it's probably wasn't understood, because where would they get their legal advice if not? But if you want it clarified in the policy, then let's just say that.
Yeah, I guess I would say, and I'd be interested in what Brian Shaw would say, so we would not want the attorney to participate in an investigation at the school because it may turn out that, there's something inappropriate. So, in other words, we may do the investigation and we would ask Mr. Shaw or another attorney to help us with the legal ramifications of that. But if he actually participated in the investigation, then he's now the investigator and may kind of cause problems for him to be able to give legal advice. So
Okay.
Yes, when we feel like that we need legal advice, we talk to the attorneys, but I don't think you want the attorney asking somebody a question, because then suddenly he's part of the investigation. Now we have to get another attorney to ask legal advice. You see what I mean?
So you're saying it's okay the way it is?
I would think so. Now, again, I'll defer to Brian. It's not that, depending on what the issue is, we certainly sometimes have to ask legal questions, but we're not going to call Brian Shaw to come in and investigate somebody
it's-
for whatever
right.
happened, unless it got to such a level that we're saying, now this is a
Yes.
legal deal, but
Yeah.
even then, it wouldn't be an investigation. It would be more like, okay, now we're kind of turning this over to something different. So I don't know that it matters, but I would just say you have to be careful. There has to be a line between those two things, and I think Brian would agree with that.
The only thing I would add is there may be a circumstance where the Board of Education itself specifically says, Board Attorney, would you take a look at this, would you investigate that? That's kind of, in a way, it's kind of outside this policy. That's specific action by the board requesting the attorney. I don't know if we'd have to revise the policy to address that. If there's any concerns, we could.
Well, it sounds to me like you don't need to
I
add
think we're
attorney into it.
okay.
So I think,
We would
it sounds to
only-
me like you're okay with it.
Dr. Loud has.
It sounds to
got
me
a-
like the policy committee was okay with it.
Yeah.
Right.
Dr. Loud has got a staff that will do the investigations. They'll
Okay,
consult
then
with me as
let's add it to
necessary.
consent, I'm fine.
Very good, because I think the issue here is the word
10 minutes, I'll
participation.
get back.
Right.
We've had other
The issue is the word
conversations that lasted just
participation.
as long.
Okay, so let's move forward without adding that. Are you good with that? Okay. So let's go back to, there are no corrections to be made other than 4150 with the duplicate number 1. Correct?
That's
Everyone's
correct.
good with that? Okay, and we're all good for it to be placed on the consent agenda for Monday? Good? Okay.
Yep.
So let's move down to 5.02, budget amendments, and I think we have Ms. Klutz on the line. Oh, here? Yeah, everybody's been on the line tonight.
Good evening, Board. I have 4 budget amendments for you today. We'll start on the first page with our state amendments. Sorry, I always have to adjust this. So with our state budget amendments, you'll find that the half of the first page are adds to our budget, so which are always good news is when we're getting more money. So the first one is textbooks. The next 3 are related to COVID funds, additional funds coming into the system. There is the normal mid-year transportation adjustment that you'll see there for about $388,000, and so that's expected and normal. Then the next one is an add of $468,000, and that's for the obligation of the state regarding the modernization project that we've finished with. We'll just pay that bill now that we have the money. And then with just some small reclasses related to the COVID funds and the timing that we received those funds. Some of those funds were received on December the 18th, and we were expected to spend them, have the check out the door by December the 30th. So that was a little bit difficult as far as timing, but we managed. Are there any?
Can I ask a question?
Yes, ma'am.
On the allocation for the textbooks, now is that for regular hardback type textbooks? That's $211,105. Is that for hardback textbooks that money they're giving us for?
No, it no longer is that way. So years ago, a couple of decades ago, we would get an allocation for textbooks, and those textbooks would be purchased from a warehouse in DPI in Raleigh, and we would fill out our paperwork, and we would order our textbooks, our hard copy textbooks, and they would send them down here, and this is the allocation that it would come out of. At some point, DPI realized, well, the textbook warehouse ended up being empty. There were no textbooks in it. Nobody used textbooks any longer. So they changed the board policy to say that it was books, textbooks, on digital resources and resources of that nature. So it's the things that we use in place of hard copy textbooks. Now, doesn't mean that we can't buy any, and we do buy some, but we don't buy them from a warehouse like we used to.
But so we could buy anything with that 200, and it could be digital, or it could be anything with that amount of money then, that 211?
It is, yes, it's anything instructional, it's an instructional resource.
Well, I have a question, and our chairman may have asked you about this. I had read something on some money that had come down. It actually had come down from the federal government, and it was in the CARES Act, and the money had actually been distributed to the state of North Carolina, and it was actually for remote learning expenses, and it was dispersed to parents originally in the amount of a $335 check. It was dispersed to parents I think it was dispersed in September, or it was dispersed in around September, October of this past year, and they had some money left over, had about $62 million left of that money, and they're going to ask the legislators maybe to do some, to possibly reallocate that $62 million, and I know we have got a meeting January the 7th with the North Carolina School Board Association and to possibly pass our legislative agenda, and I didn't know if we maybe would want to say, hey, maybe we need some of that additional funds to maybe ask for additional hot spots or something like that. Are you familiar with that money possibly?
I'm very familiar with the CARES Act and the funds that we received related to the CARES Act. I'm not familiar with any reimbursement or direct allocation to a parent, although we have received a significant amount of GEAR money that was allocated to the governor for disbursement. We've also received a significant amount of CARES money. We also expect to receive additional CARES money going forward, right? So that was just signed the last of December. DPI will start processing, determining how much each district gets. The expectation is that it's 4 times more than what we got the first round. So it is a significant allocation. We don't know what the restrictions are yet. We don't know how we can spend that money. But once DPI gets their hands around it and lets us know what the restrictions are, then we'll bring it to you and we'll talk about how we plan on spending those funds. It will be federal funds, and federal is the most restrictive out of any funds that we get. So they will tell us how we can spend them.
Thank you.
Well, is this something we should ask for, though? I mean, this $61 million, they had it left over out of this money, and originally this was, they said, to offset remote learning expenses, and I just wondered if it was something we should ask for, some of that $61 million in our legislative agenda. Is it something we should ask for part of that 60, I think it was 62 million was left of that money? Is this something we should ask for?
Ms. Carpenter, I'm sorry, I'm going to ask you just real quick. Did you read the legislative agenda that came out in the email?
When did this come out? Did we ask
I'm not
for that?
sure what the date was, but it was attached. The format was attached. I'll resend it to you, but I think that'll answer some of your questions. If we can do that maybe after the meeting, and then get that to Kelly.
Okay.
How's that?
Okay.
I think that'll make more sense to
I
you.
just got the thing today, talking about the meeting on January the 7th, that we've got to vote on it.
Right,
They
so
said
that's
we
already
needed
been
the
set.
additional ones.
Right, right. So I will resend that to you after the meeting. I think that'll make more sense to you when you read it. Is that good?
Okay.
Okay,
That's
very good. All right.
Thank you.
Any other comments or questions, board members, on budget amendments for Ms. Klutz? Mr. Furr, do you have anything?
Not a thing.
Okay, so is everyone good to place the budget amendments on the consent agenda for Monday night? All good? Okay. Very good. Next item is 5.03, and I would just like approval for my training hours for the Title IX to be placed on the consent agenda for Monday. Is everyone good for that?
Yeah.
Okay, great. Okay, with that being said, board members, do you have anything else before I ask for a motion to adjourn? All good? Ms. Carpenter, Mr. Furr?
We're good.
Okay, great. So with that, I will ask for a motion to adjourn the Monday night work session meeting.
So
So
moved.
moved.
So I have a motion by Ms. Blackwell and
I'll
a
second.
second by Ms. Sandage. All those in favor, say aye.
Aye.
Opposed? Thank you. Thank you. So with that, we will say good night to our viewing audience, and we will see you Monday night, the 11th, at our business meeting. Thank you and good night.